special meeting of the Health and Community Committee on Monday the 10th of May 21 at 4 p.m. We'll commence with taking the members' attendance. Alderman Devaney.
Here.
Alderman Guy. Alderman Wark.
Here.
Councillor Barr.
Here.
Councillor Burke. Councillor Burke. Councillor Duffy.
Yeah.
Councillor Edwards.
Here, Karen.
Councillor Farrell.
Here.
Councillor Ferguson. Councillor Harkin.
Here.
Councillor Logue.
And sure.
Councillor McHugh. Councillor Minnie. And Councillor Riley.
Here, Karen.
So can I just do a double check then? Councillor McHugh? Councillor Ferguson?
Yeah, that's frozen.
Okay, Chair, that's me complete.
Thank you. And I'll read out the statement for remote meetings. I would like to remind everyone who is in the remote attendance that this meeting will be broadcast live via the Council's YouTube channel and will be available for viewing by the public and media. The broadcast will also be available for repeated viewing at a later date. This broadcast may be terminated or suspended in accordance with Council protocol. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and use the chat facility to highlight a request to speak. By participating in this meeting, you are consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. A copy of the Council privacy notice may be found on the Council website. Okay. So members, declarations of members' interests. If anybody has any, just put them in the chat box there. Now you're announcing them. I have no chairperson's business, but I'd like to start off by welcoming our guests here today, all the members and officers, to the special meeting of Health and Communities Committee. The meeting has come as a result of a motion which was brought forward to Council on the 25th of March 2021 to receive an outline of services provided within the Derry City and Strabane Council area relating to addiction and drug users, including enforcement. So we have a number of people here today. First of all, I'd like to welcome from the Western Health and Social Care Trust, Liam Dunn, Head of Service. From the Public Health Agency, Denise McCallion. From HURT, Desi Kyle. And from Northlands, Tommy Cannon couldn't make it, so Nuala Hegarty has stepped in as who's Business Service Manager. Welcome, Nuala. Heal Hurt, Liam Stewart, founder. I don't think we have DOJ yet, do we? Barbara? No, she's not here yet. So, and from PSNI, Chief Inspector Willie Calderwood. So you're all very welcome here today. Everyone gets 5 minutes to do their presentation, and I know a few of you have slides, and I think there's a video as well from Northlands, Nuala, and that's already taken care of anyway. So I will let Liam take the stage first. So Liam, it's all yours.
Hi, thank you. I had sent slides on there. I don't know if you are going to be able to show them. Yeah. Okay, yeah. These are the same slides that I used actually just at the Civic Forum there just very recently as well. And this is just to give a very brief overview in regards to addiction services as they are through the Western Health and Social Care Trust. So if you go on to slide 2, please. So what we have is the alcohol and drug service in the Western Health and Social Care Trust it covers the whole Western Health and Social Care Trust area. So we have 2 core teams, one in what we call the northern sector of the trust, which covers Derry, Strabane, Limavady, Dungiven areas. And we have a core team then in the southern sector of the trust, which covers Aroma and Fermanagh areas. Within the core teams, you have a number of smaller sub-teams that operate under the core umbrella of the core team. So one of those services is the OST service, or the opioid substitute treatment service, and that involves substitute prescribing. Another service that we've got in there are alcohol detox nurses, who cover detoxes in the home, in community facilities, such as our partners in First Housing in Ramona House and Damien House. And they also cover detoxes within the hospitals, whether that is within the acute hospitals, such as Altnagelvin and the Southwest Acute Hospital. We then have our substance misuse liaison nurses, which work within the acute hospital areas, such as Altnagelvin and again the SWA. They link into A&E or the ED departments, emergency departments, and also then into the wards such as acute medical unit, where people may be admitted with underlying alcohol issues, or whether they present at emergency departments where there is suspicion that maybe use of alcohol or substances has maybe brought them to that department. So they liaise with the medical staff and nursing staff within those facilities and do screening with patients who present to those facilities just to check and see is there dependence there, is there issues there that maybe need input from either Western Health and Social Care Trust teams or with other teams within the lower tiers, tier 2 services. We also have then within our services the substance misuse link nurses, which are very similar to the liaison nurses within the acute hospitals, except these specifically work and do a similar job with those who present to mental health crisis services, such as crisis response home treatment teams, or they have admissions either to Grangewood Hospital or the Tyrone and Fermanagh Hospital, where there's a suspicion that there is maybe misuse of alcohol or misuse of substances has led them to present for admission to those services. Other parts of the service then that we have is we have hidden harm workers, who specifically their work is around working with the families and children of those who are abusing substances. We also have then within our services then there's a big push in regards to psychological approaches. We have appointed a psychologist within the last couple of years to our service. We provide EMDR and CBT. They're all psychological therapy based treatments. And then finally, the final part then to our service then is the complex detox and stabilization unit, which is one of 3 regional units. They are organised along regional basis. The other 2 units being one being the Southeastern Trust and the other one in the Northern Trust. So it's one of 3 units regionally. Okay. Next slide. So just as a quick overshot, basically the core teams, it's a 9-week waiting target from referral to assessment and treatment. We are currently within our 9-week waiting period, although there can be fluctuations within that depending on staff availability in regards to whether posts are needing filled or not. But we generally do run within our 9-week waiting target for referral to service and to be seen. The service as a whole across the trust receives approximately 2,500 referrals a year. When we pulled these figures together, this was at the end of April, or towards the end of April there. The community addiction team in Oma currently had 137 patients actively receiving treatment, which were open to caseloads or medical reviews. And in the community addiction team in Woodlea here within the city, it currently had 314 patients actively receiving treatment. Next slide, please. So the other parts to the service activity wise is we spoke a lot recently about our home detox service. And as I say, the home detox service, it technically is one nurse in the northern sector and one whole-time equivalent nurse in the southern sector. It's split, the job is split within the southern sector of the trust, but technically it is done by one nurse in the northern and one nurse in the southern sector of the trust, linking in through the core team. They manage detoxes at home, and if further help and assistance is required where home is maybe not deemed to be the most appropriate place, we can access then some of our hostels through our first housing partners in Damien House here in the city and Ramona House in Oma. And just some stats in regards to that is over 2019, the year 2019, they had 657 contacts in relation to home detox. In 2020, that came to 332. Obviously, a lot of things were impacted by COVID at that stage, but services have been reset and are up and running again fully. So in 2021, since the turn of the year up until, I think it was until the end of April, we'd currently had 173 contacts for home detox. For community detox then, this is the likes of Ramona House from April 2019 to March 2020. Ramona House provided 179 episodes of community detoxification. That is a house that is based in Oma and deals with male and female residents. Damien House, which is in the city here, deals only with male residents at this point in time. And that provided from April 19 to March 20, over that year period, it provided 44 episodes of community detoxification. ASHA, the complex detox unit, which is based in Oma, as I said, is one of 3 regional units. Between the 3 regional units, they have capacity for 500 inpatient stabilization episodes per year. So from January 2019 to December 2020, ASHA accommodated 150 admissions for complex detox and stabilization. They provide, at this moment in time, they provide a 4-week program, inpatient program. And as I say, it is one of 3 regional units. So it is set up and organized across a regional basis. So anybody from any region in Northern Ireland can access any one of the 3 regional units. The OST service, which is the opioid substitution treatment service, from April 2020 to March 2021, they had assessed 119 service users, and they currently had, at the end of April, there 131 currently on the OST caseload. And that is one part of the service that we're seeing a dramatic increase in calls for assessment and treatment, particularly coming from prison. You tend to have a lot of people who are put onto this type of treatment or started this treatment just prior to release from prison. So then they're followed up then by ourselves, our own services then within our trust area. In regards to development of the service, these are things that have taken place. This is the next slide. Sorry. These are developments in the service that have taken place over the last 2 to 2.5 years. As I say, recently we've had, it's about 2 years ago now, just the addition of a consultant psychologist who oversees the program in relation to the psychological program that takes place within ASHA, the complex detox unit, and helps provide not just treatment itself, but advice to other staff members within the addiction service in regards to the best psychological approaches that need to take place with people in the service. As I say, we've seen an increase in the demand for OST service, and we've responded to that within the last 2 years by actually doubling the amount of OST prescribers or OST nurses within our service. Initially, when I had started in this service almost 3 years ago, there were 2 nurse prescribers, and that has now doubled now to 4 to meet the demand. We've had a development here of it's a specific service manager position, which oversees the whole day-to-day running of addiction services throughout the Western Trust. So we currently have somebody in post in that. It's a new post, which has allowed for the likes of myself as head of service, because as head of service, I am head of service for addictions, but quite a number of other community services as well. So the development of that post gives more focus for the day-to-day management and running of the addiction services within the trust. We have increased our nursing staff within ASHA, the complex detox unit, and within the last year and a half, and we're actually going to be increasing that further as well to hopefully at some stage this year with the addition of another band 6 staff nurse within ASHA. And as I say, we've also developed, there's been the development of the link nurses, which is fairly new within the last 2 to 3 years, particularly the link nurse role within the mental health wards, which we have found to be of a real benefit. And I think we've seen a real benefit in regards to people linking in then to our core addiction services whenever they're picked up within these services initially. And the other thing then that is happening now at the minute is we're working towards open access to our service. Up until recently, we had one tier 2 service that would have had direct access into addiction services. Otherwise, you had to go back out and go through your GP to get referred into core addiction services. And what we're trying to do is to avoid having that, to decrease the number of steps that are involved in regards to when somebody presents as an issue and they need to access services. So that's all designed to open up services and increase the speed of access to service. And then just our last slide then. And this really is just about identifying some of the challenges that our service faces now at this point in time. As with any service, COVID and lockdowns and everything that has come along with that has had a massive impact on the service, particularly in our ability over the period of the first lockdown in regards to seeing people face to face. So we've had to look at a lot of new ways of working, which are, as we're doing here, virtual. Now, there's some anecdotal evidence to suggest that that has actually improved how services are provided, and that there's some reduction in our DNA rates, which did not attend rates to appointments and stuff, because people are able to access services remotely rather than having to come in person into a building. But as I say, we're still looking at the impact of COVID. We have been able to manage our waiting list throughout COVID, but now towards the end of that, there is some pressure within the waiting lists now at this point in time, but that's specifically down to do with staff changing positions, and we have new staff starting in post now in the next number of weeks. One of the other challenges that definitely faces anybody who's involved in addiction services is the increase in complexity of issues, the complexity of cases that we're seeing, where they're not coming with just one issue that needs to be sorted out, or they're not coming abusing one substance. We're seeing quite a substantial amount of polysubstance use, where they're using more than 2 substances at the one time. Demand for services is something that is always going to present a challenge to us. As I say, we are able to provide for the demand that is there now at this minute in time, but I do understand that seems to be a more of a demand at lower tier levels for the tier 2 services that are out there, and definitely presenting to GPs and mental health practitioners within the GP surgeries. And the final challenge there that I have, and this is in regards to holding the hope as services, that we need to hold the hope and we need to get the message out there to the general public and anybody, which includes yourselves as councillors or ourselves as service providers, in regards to the services that are available, because there is a wide range of services that are available at all the various tiers. And we think it's very important that the message is given across that those services are available, rather than a message being given across that there are no services or a lack of services, because that tends to lead to a loss of hope for people who are struggling and for their loved ones who are struggling with their issues as well. And really, that's the presentation that I had. I hope that answers that. I hope that gives across enough information there for people.
Thank you, Liam. Thank you, Liam, for that detailed presentation there. What I'm going to do here is I'm going to take Denise McCallion just to pair them up, and then members can come on with any questions they have then for Liam and Denise in that section. So thank you, Liam, once again. So Denise, if you would like to come in there now.
Yeah, thank you very much, Alderman Guy. Again, I've sent some slides through. You can see them. Thank you for the opportunity.
Yeah, sorry, I'm just getting the slides ready. If you just give me a second.
That's okay. No, I was just doing a wee preamble there. You're fine. We'll just wait in case there's a wee hitch. Thank you very much. I was just saying thank you very much for the opportunity to present this afternoon in relation to the PHA commissioned services for alcohol and drugs across the Western Trust area. And for those who aren't sure of what PHA stands for, that's the Public Health Agency, a regional organisation in Northern Ireland. We have our next slide, please. I thought that it would be useful just to highlight the strategic framework that we work to within drugs and alcohol. If we could have the next slide. Am I managing it or? Yeah. Okay, so currently we're working to the new strategic direction for drugs and alcohol phase 2 in Northern Ireland, but we're awaiting the release of our new substance use strategy, which is making life better, preventing harm and empowering recovery, a strategic framework to tackle the harm from substance use. So we're hoping that the strategy will be launched soon this year in relation to the way forward in addressing substance use issues across Northern Ireland. And if we have the next slide, I thought it would be useful just to mention the Western Drug and Alcohol Coordination Team. This is the multi-agency partnership in the Western area that addresses drugs and alcohol issues of concern. It's a multi-agency partnership that works very closely with key agencies addressing alcohol and drug issues in the West. Very strong in terms of partnership working and collaboration right across our partner agencies, membership from the statutory, voluntary and community sector, and also representation from service users. The Western Drug and Alcohol Coordination Team would meet about 3 to 4 times a year, and we actually have structures in place to take forward work in relation to issues that have been identified by partners in terms of formulating our action plan for the Western area. And the Western Drug and Alcohol Coordination Team is also responsible for the local implementation of the drug and alcohol strategy in Northern Ireland. At the moment, we have 2 key subgroups attached to the DACT. It's our Drug and Alcohol Information Exchange Group that would meet on a 6-weekly basis and discusses any issues of concern in relation to alcohol and drug issues across the Western Trust area. And we also have a communication subgroup that has been recently established to promote, as Liam has already said, the message of holding hope, to let people know that we actually do have really good drug and alcohol services right across the Western area, not just within the Trust and Public Health Agency Commission services, some of the other services you'll hear also this afternoon. But really keen that people are aware of what services are out there. So that's part of the work of the communication subgroup. And if we just move on to the next slide, in terms of the PHA Commission services right across the Western area, we have 8 key services that are delivered by providers within the community and voluntary sector right across the Western area. And we also have commission services through the Trust, and Liam has already mentioned those in relation to substance misuse liaison and our drug and alcohol workers within the CAM service. My next number of slides, I'm going to just detail the 8 key services that we have commissioned across the Western area. The services that Liam has already highlighted are our Tier 3-4 services, and the services that the PHA Commission are known as our Step 2, Tier 2 services. This one is the Youth Treatment Service, known as the Daisy West service, and it's a service for young people who've got issues with their drug and alcohol use. Step 2 relates to those young people who have mild to moderate issues with their drug and alcohol use, and it's affecting them on their daily lives. Currently, this service is available right across the Trust area. It's delivered or provided by a search, and they have premises in the OMA and within the Derry area. It offers individual support for young people. It offers key working for young people and family support for young people and their families. And over the last year, it has been very difficult in terms of the impact of COVID, but our services have moved to online support and telephone support and face-to-face support for those who are at risk. But over the last year, a total of 252 young people have availed of this service in the Western area, and 66% of those young people have availed of the service from the Derry Limavady area, just to let you know what it's looking like in terms of numbers. Complexity is obviously there for young people who are accessing our services. The cases are very complex, and as Liam has already said, people aren't coming with 1 or 2 issues. They're coming with a wide range of issues in relation to their alcohol use, cannabis use, cocaine use, ecstasy use, and on the whole, polydrug use. Okay, if we move on to our next slide, this service is our Hidden Harm service. It's known as the Voices service, and it's a therapeutic service for children and young people and their families who have been affected by parental substance misuse, be that alcohol or drugs. Again, a very busy service right across the Western area, and it's provided by Start 360, formerly known as Opportunity Youth. This service, again, has been very busy over the last year and has supported 74 families in the Western area, and that equates to 278 young people have availed of this service. Mostly within the age range of 5-year-old to 15-year-old within that service. If we move on to the next slide, this is our Youth Engagement Service, known as the Ost Service. This is a service that provides information and support to young people across a range of health improvement areas, which includes obviously drugs and alcohol, and sexual health and mental health. So a range of services provided for young people. The service is delivered in the Derry area by Long Tower, and it's for young people aged 11 to 25. Okay. And our next service is our Targeted Prevention Service. So this is our life skills program for young people aged 11 to 17-year-olds. There's 3 programs on offer here for young people in relation to drug and alcohol education and harm reduction and a bit of selective prevention work. 3 programs, one program for 11 to 13-year-olds, a program for 14 to 15-year-olds, and then a program for 16-year-olds. This year, they've delivered 33 programs to young people right across the Western area, to a total of 235 young people. A number of programs have obviously been cancelled because of COVID, and it didn't obviously suit to run face-to-face or online for some of the programs that had been pre-booked. Most of the programs have been delivered to the 14, 15 and 16-year-old age group, but a very effective life skills program. Our next service is the Adult Treatment Service, which is known as Steps to Change. And again, this service has been a very busy service, especially over the last year. It's a step 2 service for adults with drug or alcohol issues. It has provided support to 448 service users over the last year. And it provides a range of interventions, from brief interventions to psychotherapeutic interventions. And the demand has been for the psychotherapeutic interventions over the last year. Alcohol is one of the biggest issues. 80% of the clients presenting to this service have an alcohol issue. People under 40 who have presented to this service have polydrug misuse issues. So it's a range of drugs. And 50% of the service users are from the Derry, the Limavady area. Okay, if we move on to our low threshold service, this service, you may be familiar with this one. This is Foylehaven, or the DePaul service, based in Derry City, and it provides support and care and an advocacy and a harm reduction service for people who are misusing substances. Historically, a lot of the clients presenting to this service had alcohol-related issues, but over the last number of months, we have seen a change in the demographics of the service users presenting to this service, and seeing more heroin use and polydrug use going on within the low threshold service also. Our next service is the Connection Service, and this offers support and develops initiatives and partnerships with key agencies across the Western area. And it's a service that builds capacities for those working at grassroots community level. They would roll out a number of campaigns throughout the year: Dry January and Alcohol Awareness Week. Very much a supportive role within communities in terms of signposting individuals to the key services that are available across the Western area. This service also supports the incident protocol for drug and alcohol that I'll talk about later on. Our next service is a training service in terms of workforce development. It's a regional service that's offered right across, and it ensures that frontline workers across the sectors are competent and they're informed in regards to alcohol and drug issues. So a range of training programs on offer, and all of the training that's delivered or provided by the ASSERT organisation is actually free right across the region, and a number of the training opportunities are obviously within the Western Trust area. And our next service is the Drug and Alcohol Mental Health Service within the CAM service. It's our step 3 service for children and young people who've got complex issues in relation to alcohol or drug use and mental health issues. And it's a trust provided service. And our next service is the Substance Misuse Liaison service that Liam has already alluded to, so we can skip on to our harm reduction service, which is the Needle Syringe Exchange Scheme, which is a service that's commissioned by the Health and Social Care Board on behalf of the Public Health Agency, and it provides sterile injecting equipment and safe disposal of used equipment to people who inject drugs, not just heroin, but tanning agents and anabolic steroids. There are currently 20 of these services across Northern Ireland and 5 within the Western Trust area, 2 within the Derry area, 1 within Limavady, Strabane and Enniskillen. Okay, and we also have the Take Home Naloxone programme. This is a life-saving medicine that's administered to people at risk of opiate overdose. This is a very effective intervention that has actually saved lives, and it's available to anyone who uses opiates, and it's available through the local community addiction service, the prison service, and our low threshold service such as DePaul. And our next slide, we have our drug and alcohol monitoring and information system. This is a system that's coordinated by the Public Health Agency, and it acts as an early warning system. And really it's designed to find out about emerging trends in relation to new drugs and issues around alcohol misuse right across the region. So all of our providers can actually feed into this database, and depending on the information that is supplied, there will be often alerts pushed out through DAMIS, through the DACT, and to members or providers who are part of the DAMIS network. So for some of the providers who are on today, if you're not part of the DAMIS network, maybe we can touch base later to ensure that you're receiving some of those alerts and to ensure that you're actually feeding in to push out some of the alerts too. So I want to just highlight the drugs and alcohol ni.info website. This is a really good source of information in relation to all of the drug and alcohol support services across Northern Ireland. And there's a specific section within there under the Western Drug and Alcohol Coordination Team that highlights all of the support services available to individuals and families right across the Western Trust area. And that's really a whistle-stop tour of the PHA provision in the Western Trust. So thank you.
Okay, thank you, Denise. Thank you for the detailed presentation there. I have a few members who are looking to ask a few questions now. So I have Councillor Farrell and Councillor Mellon. Then I have Councillor Edwards. If anybody was noted between Councillor Mellon and Councillor Edwards, let me know, because I had to log back in again because my connection wasn't great. But Councillor Farrell, go ahead there.
Thanks, Chair, and thanks, Liam, and thanks, Denise, for coming, and thanks for a very useful presentation. And obviously, thanks from the SDLP for the work you do on a daily basis for people suffering from addictions across this city and district. And I was doing a bit of research before this meeting. I was looking at the Health Inequalities Report, and I was looking at the substance misuse database, and there's some worrying facts and figures in there regarding the Western Trust and regarding our council area. In terms of alcohol-related admissions to hospital, Derry City and Strabane District Council is the second highest rate across the north. But one of our DEAs, the Moor, has the highest rate in the north. If we look at alcohol deaths, again, Derry and Strabane is the second rate in the north. But if we look at the most deprived areas across the north, Derry and Strabane has the highest. In terms of substance misuse, the Western Trust, in terms of drug misuse, the Western Trust has the highest in the north, 23%. And in terms of alcohol misuse, the Western Trust has the highest again in terms of 29%, double the rate of Belfast. And Liam had mentioned one of the concerns was demand on services. So I've got a couple of questions. Liam, do you think we're adequately equipped in the Western Trust to be agile enough to respond to this growing demand for alcohol and drug services? Liam, you also mentioned psychological therapies, and that's a key aspect of treatment. The waiting lists in the Western Trust are poor. Over 1,300 people have been waiting over 13 weeks, and that's grown by nearly 50% in the last year. If we look at Belfast, there's 1,100 people waiting over 13 weeks. And you say that there's been a consultant psychologist employed, but we'd like to know, or the SDLP would like to know, when we're going to see a reduction in those waiting lists. And final question, and probably more suited for Denise. this council's corporate position is that we support a detox centre in this council area. We note that there's currently a review, a strategic review of addiction services throughout the north, and that's going to be formalised as part of the substance use strategy. Do we have any timescales for that? So those are my 3 questions. Thank you.
Okay, thank you, Rory, for that there. Liam, if you want to come in there first.
Hi, thank you. I think you're asking the question in regards to, do I think that we're adequately resourced? I believe that we're adequately resourced in regards to, you know, we're provided through the Commissioner with finances in regards to, and they're quite prescriptive in regards to the types of services that we must provide. As I say, there are regional reviews ongoing now at this moment in time. There are always going to be increased demands in various areas. And those demands actually shift from one area to another. The figures that you give there in regards to the Northwest, particularly, yes, they are concerning figures, but these, you know, the management of addiction issues and stuff like that, it's not just for the remit of addiction services, because there's a societal issue there as well too. So it's much wider than that. And my belief is that the new strategy, which has been out for consultation, there's aims within that to address all of those issues. I don't know whether that provides you with in any shape or form with an answer. In regards to my viewpoint, in regards to whether we're adequately resourced, we use our resources to the full. It's not as if we return money or that we're underspent or underspending in regards to the resources that we've got. And again, it is about working on partnership, as Denise has referred to. There's a very strong partnership, I believe, between the step 3 and 4 services, which the Western Trust are involved in, but also along with the services there that come in through the PHA that are commissioned locally by the PHA. And if we were to look at those as a whole, there is a whole raft of services that are out there, community and voluntary services and statutory services. That's the best answer I can give you in regards to whether you feel, you know, the question in regards to being adequately resourced. You asked the question then as well too in regards to waiting lists. And the waiting list that you refer to is for what's called APTS, Adult Psychological Therapy Services. In regards to those people with addictions, we are increasing our psychological resources within our addiction services. There is also the establishment of the new regional trauma network as well too, which has been doing a bit of work specifically with people with addictions and trauma as well too. And that's also been enhanced by the employment, as I say, of our psychologists and with the development of our CBT nurses posts and stuff. So there is services available for there, but yes, I do acknowledge the waiting list for APTS services, for the adult psychological therapy services, is extremely high now at this minute in time. In comparison, the waiting list to access adult mental health services through the primary care liaison services would have been in a similar situation roughly about 2.5 years ago. And we are virtually now at that point of having a no breach position in that. So there is a bit of work that is going on in the background to specifically look at the waiting list for APTS and learning from how we were able to manage the waiting list down for access into primary care liaison mental health services.
Thank you, Liam, for that there. Denise, do you want to come in?
I'll just pick up on the adequately resourced. I think from the Public Health Agency, just to put it in context, the services that we support or commission are very much to do with prevention, early intervention and treatment and support. And we would put about £1.2 million into our commission services each year in the Western Trust. And we do appreciate that some of our services, there's more demand, and some of the services in step 2 are busier services than some of the other services. So what we try and do is grow our services each year if we can, and we do that. But the drug and alcohol landscape is changing all the time. In Northern Ireland, not alone in the Derry Strabane Council area, it's right across the patch, and we need to be able to respond to that. So we do await the launch of the new substance use strategy, and it's very much the Department of Health that are leading and coordinating on that strategy. And as Liam has said, during the consultation, the Western area did have a strong voice in terms of trying to shape that strategy. So we look forward to the final publication of that. And then obviously, as part of that work, there will be the review of the commissioning services for drugs and alcohol right across the region, which again will be an opportunity for people to feed into. But we're always responding to change and doing our best to support those individuals who need the help and support, and their families, and obviously supporting the providers that we also work with. In terms of the detox piece, I think, Liam, you're probably better placed to answer the councillor's question in relation to that, the detox centre.
I suppose I'm not in a position to be able to answer that, Denise, at this minute in time, because, as I say, we provide what is commissioned at this point in time. I'm aware that the Health Minister, Robin Swan, I believe, met locally here on Friday past with some representatives and a member of the public in regards to that. I haven't had any feedback from the Health Minister or from our own department in regards to what the outcomes of that discussion actually were. So, as I say, I'm no further forward in being able to provide you with up-to-date information in regards to where that's at this moment in time. But as I had said at the Civic Forum there just very recently, I'm aware whenever you're looking at the Tier 4A services then, which are the detox units, that there are only 3 within Northern Ireland within the whole of the region. And initially it was, my understanding was initially it was to be designed with 2. And the Western Trust then, because of political pressure, then got the 3rd unit then at that stage. My understanding again is I know that we meet regionally. I'm at a meeting on Wednesday morning where there is discussions in regards to the regional access to these units. These units were very badly impacted by the impact of COVID. At the very start, as all 3 units ended up having to close in order to provide that frontline service in regards to managing COVID. So we have been managing to get our services all up and running again. But again, I know that there is a post that is going out that hasn't been filled regionally for the last couple of years, which is actually due to go out to post now very shortly. I'm hoping some stage this week. Which is a regional post, and that's about regional coordination of the 3 units, but also will actually help to start a review into the provision of detox services throughout the region.
Okay, thank you, Nate. I'm going to take a few councillors now, and then we'll come back to you, Sam, with the questions. But so, Councillor Mellon is next.
Thank you, Chair. Thank you for letting me speak. I'm not a member of the committee. I've just come on for today's deputation. So thanks to Liam and Denise so far. I suppose Rory already covered the stats for our area, and like the SDLP, Champaigner is equally concerned, and just as citizens of this area, as families, you know, parents and everything else, that we need to try and find a resolve to how we can best support people. And I like the message of holding the hope. I think it's a great message to have. And I think that we all have to be careful in our language that we are using, and we have spoke about it within this forum and council before around what implications our language can have. The most being the tsunami that's coming. You know, we've heard that time and time again the last few months. and even people who may not suffer from addiction or mental health. You know, it can be quite alarming. It can leave people feeling a lot of tension. So I do feel that the messaging that is brought out, although we have to face the ugly truth, is that we need to be sensitive and careful on what we're doing, and we're very much committed to that. For questions, I was just looking to see around in terms of young people. As the representative for children and young people from a party, I don't think anyone on the call would be surprised that I would go to that direction of it. But I was just wondering in terms of individuals within the Derry area. I know you spoke of the Daisy and Hidden Harm Voices programme and stuff as well. How, whenever you spoke about the numbers, you spoke around what it equates to, how many people. Can I ask how many individual unique members or users or clients or whatever has been through that process or through them programs, and what tier 3 and 4 services are there for young people and children here in the Derry area or the service of Derry area? I suppose another comment that I would like to make would be around the disparity on perceptions of what is available here in Derry for people. And for my point of view on it is that there is a big disparity on what we hear on a day-to-day basis from, you know, our constituents, our families, friends, people who do suffer addiction or mental health, as opposed to when we come to these forums and we hear of all these services and they're brilliant that they're there. So I suppose it's around the communication subgroup or the comms team. What outreach work do they do? What public messaging do they do? And I fear that there is a lack of going out because of the demand that will be placed there. But if people aren't aware of services, surely it's to the comms team to have to go out, and people shouldn't have to go and hunt out what is available. If I had a broken leg, you know, I know where to go and what to do. I don't have to go and ring 5 different people or do something else to try and get access to that. So I do believe that the pathway and the comms teams is a big hurdle and a barrier to the people who aren't able to currently access service. And although there is a waiting list and there is a demand on it, that I don't think that's merely enough of what people are actually out there and don't know that it's there. But again, thank you very much for the presentation, and I hope we do see some pulling together partnership approach. Just one final thing before I do go is that when we talk about partnership working, can I ask how often stakeholders and different partners are brought together, either in networking, sharing information when it comes to better provision for people, or to let people, each other, know what's going on. I do know, like in the third sector, it can be a competitive process. You know, there's voluntary groups coming up, but is there a charter? He's come together, do you network often, and what happens there? And sorry, Chair, just one more. I would like to see what your thoughts are around. I know Damas has put it out before, and we've had calls locally around the vaping space. And if I could see, know how concerned we should be for the prevalence of it around the town.
Okay, thank you, Councillor Mel. Councillor Edwards.
Chair, thanks for letting me in, and also want to thank Liam and Denise for their presentations. I'm just going to keep it short here. The first issue is for Liam, and it's a concern that's been raised with me. Look, I'm a Derry councillor, so I'm at the other end of the council area, but the Asha Centre in Oma, the waiting list for it, and I know that from the, I think it's when it's reopened on the 3rd of August last year, I think it's had 52 admissions, but there's currently 25 on the waiting list. And I think, Liam, you may have referred to it earlier around additional staffing, but I'm just wondering, could I get some more detail on that? And I know it is a regional centre, so that, you know, that waiting list could be anywhere across the north, but I would also like to, you know, what support those people on the waiting list are getting as they're waiting for a place. In terms of Denise's presentation, it is good work to hear about the youth initiatives run by the PHA. And I would just like to ask whether are they being run in sort of rural towns and villages, or are they just focusing on urban areas? Because like all our councillors on here, we've seen like everything during the pandemic, we've seen a massive increase in drug and alcohol use among our young people, which is very, very concerning. So I would just like to know if they are being run in our rural towns and villages, or whether there's plans to run them in future. Thank you, Chair.
Thank you, Councillor Edwards. Councillor Doyle.
Thank you, Chair, and thanks to Liam and Denise for presentations. I suppose my concern around all of this is, and why I brought this motion forward originally, is because that we can talk about services, but there is obviously a problem in the community whereby more and more people need support and they need access to services. So, for example, Liam, I know that maybe you have got a chance to chat to Karen yet, but I was at the meeting with the minister on Friday around a detox centre, and that's of course that's our corporate position, and I suppose I'll come back to that. But in relation to the and I know other members have mentioned about worrying figures with regards to the home detox service. And maybe this from the trust might be a good news story, but it's rather worrying from where I'm sitting. Is that from 2017, from when the service started, the usage by women in Derry, in terms of the proportion of all of the users right across the Western Trust, has gone from 23% in 2017 up to 92.2% in 2021. Now, I know that's obviously a limited version of 2021, but it's the same with regards to male users. 35% of the Trust's usership in 2017. Now it's 67.6. That's one ream of the service. We also know, of course, that there are 60% of the people who go to ASHA come from this city and district, and that is likely to rise. So I suppose the detox piece is very important, because when I look at and I think the unique piece for Derry is that that 60% is very clear in terms of the people who need the service and use it. I've got the figures recently from the Northern Trust, for example, and the profile of their users isn't anywhere near the same in terms of it being very much from one geographic area. So, for example, the two top areas for the Northern Trust, there was 57 last year from Ballymena and 42 from Newton Abbey. So there's a massive disparity there in terms of their geographic uptake. We have recently, I think only at the last full council, I think it was, in relation to the post that you spoke about, the regional post that I was in contact with you about, have agreed and sent a letter to the Trust asking that in relation to the scope of the review that's going to be taken on the Tier 4 services, and assuming that's just Tier 4 only, maybe you can set me straight on that a specialist detox provision be centred in the city and district, because obviously that's our corporate position. So I'd like to maybe hear your views on that. The minister didn't rule out a detox centre. I didn't expect that he would. I thought that he was very welcoming towards it. The key message, of course, is that we do need to make sure that people know about the services that are out there, and we've been in contact before about how we can do that via council corporately, and we have a member of our comms team on the WDACT, and we want to make sure that, sure I speak for all members when I say we want to get all that information out. But that is one piece of the puzzle. It doesn't take away from the fact that, like Aileen said, that there almost is a disparity at times between what we hear on the ground and what we hear at these meetings, because, the call for detox is very strong, very clear, led by Tamsin White, and it isn't going to go away. So I'd like to hear your views on that. And just Denise as well, thanks for your presentation. On the WDAC, you mentioned that there's a discussion, that issues that are coming up or that are prevalent in the area come up at the WDAC meetings. Has there been any discussion at the WDAC meetings, for example, around the detox centre? Because I'd like to and the reason why I'm asking is because council corporately have a member of staff on that, and it's our corporate position, do we need to do more to get that on the agenda at the WDAC as well? So thanks very much for your both presentations. Thank you.
Councillor Doyle. I'll go back now to Liam and Denise So if you want to come in there.
There's a lot of questions there, and I'm just trying to figure out because certain ones there will be specifically for Denise, I think there, and certain ones will probably be specifically for myself. I'm just going to try and capture the ones, Denise, if that's all right, from my point of view first. Is that okay?
Yeah.
And apologies, folks, if I do miss something, and if I do, please come back and ask me again. The first one I picked up on there was in regards to you're talking about tier 3 and 4 provision in regards to children. Now, my service area is in regards to 18-year-olds and above, but there is addiction workers within the CAM service, the Child and Adolescent Mental Health Services, and they do have access through to specialist help within the adult alcohol and drug services as well. Although we've got that notional lower age limit, it's hard for me to say, the lower age limit of 18. That doesn't prevent us getting involved with people under the age of 18 if we believe that they actually do require the more specialist input. But they do have workers within their own child and adolescent mental health services. It would be very rarely that they would be looking to access the tier 4 services, but if that was required, then that's an option that would be open by coming through the tier 3 service. The other bit there in relation to ASHA, and it was more about the waiting lists and about the support for people on waiting lists. Well, anybody that's on a waiting list for ASHA, which is a tier 4A service, they have to be on a list for tier 3. So they are already currently open to alcohol and drug services with key workers and all the input that they have through the core services. So in regards to the waiting list overall, yes, COVID has badly impacted, I believe, on the waiting lists for not just ASHA, but for the other 2 regional units as well too. They're part and parcel of discussions we're having as in regards to going back to the drawing board to look about when these services were set up, what was the way that they were supposed to be set up, how was the provision. There are 2 bits to a tier 4. There's a tier 4A and a tier 4B. The tier 4A example in our trust area is ASHA, and the tier 4B service is the example is Northlands. So it's about how the 4A and the 4B link up with each other. And it is on there, I believe, but I suppose from my point of view, I'd like to think that the relationships that we have with the Northlands Centre have improved vastly over the last number of years. Okay, sorry, folks, I am not too sure if I'm actually online. Have I come? There's something happened there, and I don't know.
You're okay.
Liam, now.
You're sort of cutting up with me a bit there too, but it might be mine because mine's has been bad all day. I've had to jump back in.
Okay.
I think it was, so we were missing that part there.
Say that again, sorry.
Around the tier 4 A and B, I think it was, where you were.
Yes, services are set up for tier 4A and tier 4B. As I said, the example of tier 4A within the Western Trust area is ASHA. Tier 4A are complex detoxification and stabilisation units. And throughout the province, they've got different length of programmes. The programme within ASHA is a 4-week programme at this point in time. The programme within the Northern Trust is a 2-week programme. And ideally, when these services were set up, it was that 4A and 4B services would dovetail nicely together. So the 4B services, such as Northlands Centre, provide rehabilitation, counselling type of activities, whereas the 4A provide the actual complex detox and stabilisation. But so part and parcel of the review, my understanding, is not just about the tier 4A, but it's also about the provision of all tier 4 services, as Councillor Doyle, I know, was saying there. He thought, just to clarify. Now, as I say, that's the remit for that isn't actually out at this minute in time, but that would be my belief been involved in conversations up to now is that will involve a review of both Tier 4A and 4B services and how they all linked in together. I don't know if I've missed any questions. Do you want to go over to yourself, Denise, in the meantime, in regards to their pieces?
Okay, a lot of questions in there too. I'll try and pick up in relation to Aileen's. And firstly, Aileen, in relation to the Health Inequalities report, it does paint a really drastic picture for the Derry Strabane Council area. And I think it's important to say that in terms of addressing the alcohol and drug issues right across the district, health can't do it alone, and we know that. We know that we need to have a collective response, and we know that we have to work across all government departments, and it's key that we're working with council in terms of responding to issues. So absolutely, there's a massive job of work to be done, and there's no bones about that. Also, in relation to the language, you're right, language is so important, and we need to be very clear when we're actually communicating with people. In terms of stigma, we know that some people aren't accessing services because of fear of stigma, and that's something that we need to address. So language is crucial in terms of providing support. And I think the new substance use strategy is very positive in terms of the title of that strategy when they're talking about preventing harm and empowering recovery, which is really good, positive language. And we need to be using the right language, and we need to be using positive language and ensuring that it's all about holding hope for people. In relation to the communication subgroup, Aileen, it's a new subgroup that has been set up through the DACT, and it's comms representation from council, from the trust, and from the Public Health Agency. It'll also involve representation from our other councils in the Western area and from our colleagues within the PSNI, because it again is a collaborative response, and again the communication piece is key in terms of letting people know out there that the services are there, but more importantly letting them know how to access the services. So we will have a communication strategy and a plan in place, and that will detail the actions that need to be taken forward to address some of those issues. So points well taken. In relation to the young people accessing the services or Step 2 services, the DAISY service over the last year, with the impact of COVID, we've had 252 individual young people accessing that service. Okay, those young people then obviously have a care plan in place, so some of them will obviously be part of that session or part of that service for a longer period of time than others, but it's very much person-centred, and it will be individual care plans. 40 families have been supported through Daisy West in terms of working with families again with care plans right across. In terms of the Hidden Harm service, I had mentioned that 74 families were supported, and that actually exceeds the target for that service this year. And within those 74 families, there was 278 children and young people supported. And again, some of those children and young people will be supported for as long as it takes to support them. Okay. There are all the figures that I have in relation. If there's anything else, Aileen, that you want, come back to me and then we can supply that. In relation to the partnership and the networking piece, the Western Drug and Alcohol Coordination Team meet 3 to 4 times a year, and one of those meetings will be a planning meeting where we actually plan the action plan for the year ahead. The action plan is a 3-year action plan, but it's a fluid plan that obviously needs to be reviewed in terms of emerging issues or concerns within the locality. Under the DACT, we have the Drug and Alcohol Information Exchange Group, and that group meets every 6 weeks. Okay, and that's key stakeholders within the drug and alcohol field come together and build relationships and network. So that's a really, really good platform. And that is solely for those workers within the drug and alcohol arena and with our colleagues in the trust and the PSNI. So it's a really good networking opportunity. We also have within the Western area, and we're unique in terms of this setup, we have 3 drug and alcohol forums in the Western area that are facilitated by our connection service. And that forum would meet, or those forums meet on a regular basis throughout the year also. And they have their local action plans, which respond to the needs within their locality. So we obviously have the Foyle in the Derry Strabane area. Okay, so I think that's it in terms of the networking. In relation to the vaping of spice ailing, it seemed to come in waves across the region. We had some isolated incidents reported through the DACT and through our providers, but not a significant issue in terms of presentations to services or coming in through the information exchange group. We have had pockets, and the PHA have responded to that whole vaping of spice through their social media campaign that we would have pushed out through our local networks. So I hope, Aileen, I have answered most of your questions. I was jotting them down as we were going through, but if there's anything else, do feel free to come back.
Thank you very much.
Okay, I think we'll go back for more questions now. Alderman Devaney is next there.
Thank you, Chair, for allowing me in. And quite a number of the questions have been answered with the last contributors. But I think we would all agree here and around this meeting today that drug and alcohol abuse and the waiting list for those issues is causing great concern. And as a rural councillor, I always raise the issue around how is the message going out to those rural people out there, and they don't have the urban environment around them where they know there is services there. But I do believe that the public message is a very, very important one out there, and to get that out there and that help is available. And I do agree with some of the previous comments that there is a stigma, but we have to try and get that message out there. And I'm just wondering how that message is relayed out there to the public arena, and especially when we look at our young people, how that message has got out through our education system or schools and places like that there, and the message very clearly that the harm addiction can cause across the council area. And our party would be very supportive too of a detox centre, and I would just like to know how that message is going out there, because yes, the stigma and giving people that confidence that if they do feel they have a problem and they need to go and get help. And what I find sometimes is when people pick up the courage or the confidence to go and look about help, it takes a long time before they get on to the different levels across the helpline to feel that their issue is being addressed. But thanks, Chair, for allowing me in, and thank Liam and Denise for the presentation.
Okay. Thank you, Alderman Devaney. Was everybody able to pick up Morris there? Okay, yeah. Or was he breaking up with everyone? Are you all right there? So Councillor Harkins next.
Thanks, Chair. Yeah, first of all, thanks to Denise and Liam for the reports, and also the you've answered a lot of questions already in a lot of detail, and that's really helped to kind of widen our knowledge of what the work looks like on the ground and the challenges that you're facing. And look, it's very clear we have some excellent services. We have many excellent services, and that we have a lot of very dedicated people who are working around the clock and bending over backwards to try and protect people and keep them safe. We have to fully acknowledge all of that and the great efforts of people. So that's what I want to say to start out, and then I have a few points and then a couple of questions for you. I mean, look, I just find the health inequalities report absolutely stunning and shocking, and I will not hold back in terms of the language to describe this, because I think if we do that, we actually allow the Stormont executive and the people responsible for creating a situation in our most deprived areas where people are, you know, it's clear now, depending on where you're born, you're going to live a shorter life, and that's male and female. I mean, this is just absolutely unacceptable. We have an executive that hasn't had a strategy to combat poverty, and I think that these health inequalities that we're seeing are a lot to do with the outworking of that. It's just incredible. So, I mean, we have to have hope for people in terms of encouraging people to access services, and there are many excellent ones, but that can't be the end of it. I mean, if we allow a situation to develop, and that's where we're going now, of more and more poverty, where these deprived areas are going to increasingly get left behind, that is going to stretch our already stretched resources to impossible ends. So I think we have to yes, we have to be careful about our language in terms of giving people hope and that there's a way forward, because people so often are told it's your fault if you find yourself in this situation. What we're actually seeing is it's structural. It's dependent on where you're born. It depends on where you live, what your life chances are, what your life potentially might look like, and that's down to government policy. And I think we have to talk about this. So one question for you is going to be, can you say a bit about, in your experience on the front line, the relationship between growing deprivation and then the type of services that people are being are having to access? If you could talk a wee bit about that, because I think we can't leave this out of the equation. It's so important. And then the second question is about stigma, and we talked about stigma, and there is a lot of stigma, and of course people are doing a tremendous amount of work to break the stigma and to encourage people to talk about mental ill health, and drug misuse and alcohol abuse and all those things. But there's also then the criminalisation of drug use, and that creates another layer of stigma. So it would be useful to hear if you have thoughts about criminalisation and what barriers that actually presents to people who need to access services. Because one of the discussions we've had in council, and one of the discussions that's obviously happening internationally, is about the failure of the war on drugs, the attempt to criminalise certain drugs, and how that's actually worsened the problem. And now you're seeing around the world places experimenting with legalisation. You look at Portugal, you look at the United States, where cannabis use is basically getting legalised right across the US. And that's not the direction that we're going in here. We're going in the opposite direction, where people are calling for more of a law and order response. That's all we're getting from the Stormont executive parties. So it'd be useful to hear from your perspectives, if you're in a position to offer it, what your view would be in that. And then there's just the whole question about the budget towards mental health services is still very, very low here compared to the other 5%, compared to 20% elsewhere. And obviously that has a big impact then in terms of people turning, or people, in terms of drug misuse and alcohol and so on. So, if you're in a position to take up any of those, it'd be very, very useful to hear your thoughts on it. Thank you.
Thank you, Councillor Harkin. Councillor Ferguson.
Thank you, Chair, and thank you to Denise and Liam for the presentation today. And I just want to say thank you for all the work that you are doing. Mine's is going to be in a similar kind of tone as the previous councillors. First of all, Liam, obviously we have the second highest alcohol emissions in the Northwest, and I think for yourself, the message of holding hope, I know it's very important, and other councillors have expressed that that's maybe not the message that we're getting on the ground. One that I would get a lot from constituents or people with mild misuse that present, to A&E or to their GP, are being sent home to just try and deal with it themselves, and there's no kind of support there, and maybe waiting for, I don't know, a referral to a consultant that maybe 2 years, and things escalate. So there doesn't seem to be a pathway there for them, similar to the mental health, and I don't know whether that's lack of knowledge of what services are out there on certain departments. So I think your message of holding hope is definitely something we need, but it's something we need to kind of break through in all aspects of the service and the trust. I know, Denise, you were talking about the young people and prevention, and I suppose for me, as a rural councillor, I have the same concerns. I have seen vape and spice in rural villages, and I'm being told by primary school headmasters about it, so it's not the 11 plus. So I'm wondering whether there's going to be some sort of, I know you said one of your programs, one of the programs does tackle from 5 up, but the majority of them are 11 plus. So for me, prevention is being proactive and kind of trying to get into that younger age group and see, and I'm just wondering if you think that's going to be something that will come out of this new strategy, because especially the ones that I'm seeing, this is over the last 18 months, they're just getting progressively worse because there hasn't been any prevention for them, and yourself, everybody's under a lot of strain and a lot of waiting lists. So, but again, I just wanted to, I'll keep it short and sweet. I just want to say thank you both, and if you could just give me a wee update on those, that'd be great. Thank you.
Thank you, Councillor Ferguson. And last one, Councillor Gallagher.
Thank you, Chair, for letting us in. And I thank you for the presentations. Chair, short and sweet as well. Just it's a question probably for Denise. And to see if we're going to win this battle, it'll not be won, in the hospitals or in the detox centres. It'll be won in the home, and it'll be around very much parenting programs, and as we see, like kids as young as 11, taking drugs. One of the key things I think that we can break us from a young person's point of view is around, the self-check multi-drug test kits that for parents they have great difficulty accessing those kits. There's an element around, and we can't lock our young people up. So there's a fine balance of kids that having to get access to these through parties and all that type of stuff, and particularly by COVID and Strabane here along the river, there's been sort of raves, open air raves and all the rest. But for parents that are working with their kids and want to work with them and monitor them, they can't get access to these kits. So that allows young people, they go out and just say, "I'll not get caught," and I'm not talking about criminalizing, but I'm talking about trying to keep them that parents can monitor them and know they're monitoring them, and can keep them off it, so that they won't get access and they won't go to a party and they won't say, "Hi, I'll be grand, I'll be sorted." But if they know their parents are going to say, "I'm testing you in the morning, and if you were on drugs, I know you're on drugs." Do you know what I'm getting at? So I think that's where I see it in one, rather than talking about criminalize young people, building more prisons and put them in prisons. I think if we work through the home, that's where we'll win. Thank you.
Thank you, Paul, for that there. So Liam and Denise, you want to come back in there?
Yeah. Do you want to start, Denise, or do you want me to start? There's a number of things there that probably cross between trust and PHA, and there's a number of issues there that are raised. I suppose they're asking for our opinions on things, and I think we've got to be careful in regards to asking for our opinions and whether they're personal opinions, because we represent organizations, we represent teams and stuff, And there is a lot of stuff there that has been spoke about, you know, that's far and away outside of health services remit. You know, stuff such as decriminalisation of cannabis, stuff such as minimum pricing of alcohol and stuff. There's a lot of other stuff that is going on there at, I suppose, at regional level. And there are a lot of discussions that are taking place in regards to those. The biggest thing that I think I could say in this regard is, and I'm looking at myself here from a personal point of view in regards to my history within services, is I have worked in the Western Trust for 35 years. It's only within the last 3 years that I have actually got involved in addiction services. And actually what I would say is that this last 3 years has actually been an eye opener to me in regards to the services that are actually available. And that says something about us as a trust and us as organisations to a degree, that if I was in an organisation here for 32 years before I came across and actually over addiction services, I couldn't have told you about all of those services that are out and about there, and all the great work that happens between those tier 2 services, those lower level community and voluntary services, you know, the tier 2 stepping up and how they work in partnership with tier 3s and tier 4s. I have really had my eyes open in the last couple of years in regards to the amount of services that are there, all the various services and all the different bits and pieces that they do. So, you know, when you go back and you talk about somebody who's from a mild use point of view, who is maybe appearing at the likes of Alton Galvin, and then is going out and going, well, I wasn't given any advice and there's nothing there for me. Therein is there's an educational bit for staff within the trust, we believe, in regards to understanding what services are there, as well as for the general public. But that is also where the role of the substitute misuse liaison nurse actually comes in to help point that out. Is people with mild use is not about coming onto statutory services, but it's about looking about what organisations and help and support is out there within the community. The whole thing in regards to stigma, the biggest stigma to people is about going to their GP to ask for help in regards to accessing services. And what we're trying to do is we're trying to work from avoiding people having to go to their GP in the first instance. There's a number of services out there, the tier 2, step 2 services, Denise would know about, that have actually open access. You can go to them without being referred from your GP. And what we're trying to do at this step tier 3 level is to try and open that out as well too, to avoid that stigma inducing, but where people have to go to their GP. It could be a family GP that the family has had for a number of years to talk about an addiction that they've got. Denise, I don't know if there's anything. I'm just very conscious of it.
Yeah, no, you're right. There's obviously points that have been raised that we're not in a position to comment on. In relation to, I think it was Mars's question about how are we going to get the messages out. That will all be populated within the communication plan, and obviously we do have the SED cards and directory of services in place that are pushed out through primary care, pushed out through community, through your healthy living centres, through a range of service providers. There's the website that we really need to do a bit of promotion around. There's social media will be key to pushing out messages, but we also need to be very creative and innovative in terms of trying to reach the hard to reach groups in relation to our harm reduction messages around a range of different drugs. So there's a whole piece of work that we will be doing over the next while. In relation to, I think it was Councillor Ferguson's piece around the vaping, and I think I heard you say 11-year-olds and primary school children vaping. That's certainly something that hasn't been raised to the DACT or even locally through our providers to the PHA. Keen to hear a bit more about that, especially when we start to look at the commissioning of services as we go forward, or the review of the commissioning of services. And certainly if our life skills programme needs to be looking at young people under the age of 11, then we need to be looking at the evidence base around that. And certainly it won't be something that won't be dismissed if the evidence is there. We'll obviously listen and respond accordingly. In relation to the parenting piece from Councillor Gallagher, And the drug testing kit's not in a position to comment in relation to that, but what I will say is that parent-child communication is key in all of this, not only in relation to drug and alcohol issues, it's the same with sexual health issues, mental health issues, sexuality, all of that. So there are a number of parenting programs out there that obviously need to be promoted also. And I think it's important to point out too that young people will experiment with drugs and alcohol, and many of them will leave that experimentation behind. And some of them will develop some problems and will work through the problems. And then for some, obviously, it's a difficult situation for them in terms of dependency and real issues with their alcohol and drug misuse. But certainly parent-child communication is key, and it is something that is taken very seriously through a number of the programs that are pushed out. In relation to our previous question, in relation to are the services just in urban areas? No, the services aren't just in urban areas. If self-referral comes in or referral comes in from any agency, then obviously the workers work with the individual and they meet them outside of COVID times, face-to-face at localities that suit them. And they have obviously used health centres or different facilities within communities. So rural communities, if individuals present to services, they are definitely picked up and seen by our service providers, regardless of what postcode they live in across the Western area. I'm hoping I've picked up most of what has been raised.
Everything has been covered there, Denise. If I've missed anything, anyone can let me know that asked any of the questions there, but I think everything's been covered. Same as well, Liam. Thank you for the presentations. Thank you on behalf of the members and officers for taking all the questions and answering to the best of your ability. Thank you. Much appreciated. And we'll move on now to some more presentations. And with Desi Kyle, manager of Hurt, up next. So you have the floor there, Desi.
Okay, thank you very much. I wonder if I could make a couple of wee comments just before I start my presentation, which you'll be delighted to hear. It was quite a short presentation for a number of slides and will only last a few minutes. I was very interested to hear Liam say he's been in the position for 4 years there and he's got his eyes opened about the number of services. And likewise, I was quite interested in his presentation and to see the range of services that the Trust provide. I've been working also in addiction and associated with Hurt for 20 years, and I honestly didn't know the range and extent of services that you provide. So that reinforces, I suppose, my call for more, one of the councillors mentioned earlier, for more collaborative working between community groups and statutory services. So I would really like to follow up on that after we get our head above this, the COVID, and as things begin to ease up. And it would be great to meet up with you. The other wee comment I would like to make is to thank Tasman, whose campaign has raised awareness, and I suppose is one of the reasons why we're meeting here tonight. We've all mentioned so far the amount of services that are available locally, and I suppose I would be interested to hear what the deficit is, what services are not here. From our point of view, we definitely would support the campaign for more detox services as part of our wraparound service, so that those other facilities could be there as well to support people in their journey through addiction. And one wee final thing before I go into my presentation is we work with opiate users, heroin users, needle users, and we have 3 staff trained in naloxone provision, and yet we don't have access to naloxone. So I wonder, is that something that could be looked at as well? So Karen, if just to start my first slide there, introducing our organisation, Hurt, Have Your Tomorrows. This is our 20th anniversary. Hurt was started in 2001 by the current coordinator, Sadie O'Reilly, after the death of her own son who died from heroin. So for 20 years, we've been delivering intervention and support to individuals and family members of those impacted by addiction. Our staff are all qualified and experienced in their respective fields, and we have counsellors, therapists, child psychotherapists with all who are members of all the relevant governing and professional bodies. And we work with roughly about 300 service users per year in Derry and Strabane. If you go on to the next slide, Karen, please. Karen? Hello? Hello?
Yeah, go ahead there. As it jumped
Have you
forward.
Have you heard the first part of my presentation?
Yeah.
So, okay, right, we're on to the next slide.
I think we've
just dropped out a wee bit there. Okay, so hopefully you can hear me again. So we're an accredited training provider, and we offer programs from level 1, drugs and alcohol information and awareness, up to level 5, substance misuse theory and intervention. And we also deliver intervention and awareness programs through primary schools and post-primary schools to about 168 students per year. Next slide, please. So we work in partnership with the community pharmacists to deliver awareness programs around, and surprisingly it hasn't been mentioned yet, about the amount of prescription misuse. And I'm not sure what this last year's statistics are, but 2 years ago, there were statistics verified that there was more people dying in the north through prescription medication than through illegal substances. So in response to that, as I say, we've developed a joint working program with the pharmacists, and we've been working with the pharmacists for about 6 years, right throughout the community. Next slide, please. So we pride ourselves on the fact that we have minimum waiting time. And for those who present for support who are in crisis, we offer them immediate support. In other words, they're seen there and then on the day. We always have trained staff. So we're funded mainly through grant giving organisations, National Lottery, our own social enterprise and fundraising initiatives. And unfortunately, we receive no government funding for our services in the Derry area. All of what we provide to the public is free of charge. So I'm happy to take any questions.
Okay, Desi, thank you. I'm just going to take a few more. I'm going to take 2 more presentations.
Okay.
And then we'll include them all. So if everybody keeps their questions for Desi and not their one there. So if we go to Northlands now, for Nuala Hegarty.
Hello. I think we have a short video we're going to show you. Basically, this is. Sorry, can you hear me now?
Hear you?
Yeah, we're going to start with a short video, mainly on the. Is that playing? Just 1 wee second. Sorry. Oh, here we go.
Hello, my name is Nuala Hegarty. I am part of the management team here at the Northlands Addiction Treatment Centre. Northlands has been serving this community for almost 50 years, and the pandemic has been the hardest thing we've ever had to face. It's forced us to adapt and change, but the core of what we do remains the same. We have over 40 staff and volunteers working here at Northlands. This is a mixture of professionals and people with their own lived experience of addiction. So whenever you pick up the phone for the first time or you come through our front doors, you're going to be met with acceptance and compassion.
Hello, Northlands.
We know that for many people, making that first call will be the hardest call you might make in your life.
How can I help you?
But we want you to know that when you do, there's a team of people waiting and passionate about your recovery.
Sure, yeah.
Our counselling staff continue to provide much needed one-to-one support. In the past 12 months alone, they have delivered over 2,200 appointments to people across Northern Ireland. Our kitchen and housekeeping staff are working harder than ever to prepare healthy, nutritious meals and keep our building clean, comfortable and safe. Our volunteers are critical to the work of Northlands, whether it's aftercare support, nighttime supervision, or running a yoga class, we couldn't do without them. The pathway out of COVID is still unclear for all of us, but what is certain, we remain committed to doing what we do best, supporting people towards recovery. If you or someone you love is struggling with addiction, we're here, we're open for business. Please give us a call on 7131 3232.
So thanks for watching that short video. I think it's coming from our own idea, what Liam and Denise has mentioned before, that we felt there was a perception in the community that, you know, services, especially throughout COVID, possibly weren't available. There seemed to be a message there that that was going on. So we felt it was important from us, and we have produced that short video, and we've produced a range of other videos to follow up, just to go sort of through our own social media platforms. I'll just basically tell you a wee bit about Northlands, about the services we offer. So it's everything from straightforward information and advice to also we offer on a yearly average about 500 prelim assessments. So the majority of these people would go on to have more non-residential face-to-face appointments. We don't have a cap on this either. People can come and attend Northlands for as long as they wish. And then each year, about 60 people would be admitted into our residential program. In normal times before COVID, this was a 6-week program, and we can facilitate up to 8 people at any one time. Before COVID, we were at 100% capacity. The year previous, we had 62 residents. We also offer an aftercare program for residents coming out of a residential program. That's a 2-year aftercare program, which is a mixture of follow-up face-to-face appointments with the counsellor and also group aftercare, sort of peer facilitated. Obviously, COVID has had a massive impact on the way we can provide our service. The biggest impact really has been the physical limitations of our building. So we've had to reduce our capacity purely down to social distancing, down by 50%, which means at the moment we can only facilitate 4 residents at any one time. We're making great strides towards maybe upping that in the next few months to do some kind of adaptations to the building. Also, as we've said, our non-residential appointments, usually we would provide maybe 1,500 plus appointments a year. This year, the year of COVID, that has been 2,200. As Liam kind of mentioned before, this has to do with people, there's a bigger uptake because it's more accessible to people, which isn't always a great thing. Sometimes people show up to an appointment, they've made a commitment to it. While telephone counselling and video counselling is a great alternative, it's definitely not a replacement for that therapeutic setting. So that's basically just our short wee bit. Thank you very much, and thank you for the opportunity too. Thank you.
Thank you, Nuala, for that there. And we'll take one more. So it's Heal the Hurt, and it's Liam Stewart.
Can you hear me now?
Okay.
We're coming through there, okay? Can you hear me now?
Liam, go ahead. Yeah, no, I hear you.
Okay.
Yeah, go ahead.
Carry on.
Yeah, there, just, yeah.
Liam, we can hear you, I think, mainly.
Oh, you can hear me, right? Thank you very much.
Yeah,
Well,
we
listen,
can.
Right, okay, thank you. Well, I'd like to thank everybody for taking part today. Heard a lot of important stuff. Well, I'm the founder of Heal the Hurt. We're going over 5 years. We're a registered charity. We've received no government funding or no funding from anyone, and we keep going. At the moment, our services, there's no appointment needed. I hear the waiting list there sometimes was 9 weeks. I heard mentioned today, and I was thinking, where's the support for people who has to wait the 9 weeks? I've been involved in addiction a long time. Our service is getting stronger and stronger. Like, we would have over 20 people on tomorrow for therapy, so we're treating over 50 people a week. Now that we're only on 2 days a week at the moment because of COVID, on a Tuesday from 1 to 4 and a Friday from 1 to 4. When COVID lifts, we'll be back on Monday, Tuesday, and Friday, and a Wednesday night. And the Wednesday night is for families of people with addiction. I heard families mentioned today. And my experience, they're the ones that are really suffering when they're totally powerless of trying to get their children out of addiction. One of the most powerful things. This war against drugs, I hear that mentioned. There is no war against drugs. Drugs is one, hands down. There is no fight. Collectively, of all the agencies that's going on here, there's very little progress, in my understanding, for us all collectively going making a dent and a way forward in addiction. Again, what is the way forward? I keep getting asked that question for over 20 years. I believe my own experience is that education is the way forward. And to come in the recovery and the counselling and dropping the word understanding of addiction. It's a complex issue when you're talking about addiction. Many different theories of recovery for it. The ones that we work the 12 steps of recovery. Not the only way of getting clean and sober with drinking drugs, but one of the oldest, most successful modules up to date. So it's using Alcoholics Anonymous, Narcotics Anonymous, Overeaters Anonymous, Sex Anonymous. Very successful program. We provide a one-to-one service as well. I think in my experience, way I made it no appointment, that when people have to wait for a few days, they seem to recover that wee bit better, and then the walls go up and they be defiant. There's a professor in addiction I've been following for years, and he says people in addiction get them when they're most vulnerable. That's when their walls are down and you may get through to them. The success rate of addiction, people going to treatment centres, is very low. I don't hear deaths being mentioned and families traumatized forever. There's nothing fancy about addiction. There's 41 people in my group dead and buried. None of them, bar one, made the newspapers. So it's really sad, and families are left then to deal with this trauma. And don't forget, it's generation of trauma after trauma or trauma. We're coming out of the troubles in a traumatized area. Parents before us traumatized, children traumatized. It's all trauma. And the escapism easy then. I'm talking from my own experience. I'm a recovering alcoholic and drug addict, and I'm in recovery coming up in 28 years. But on them 28 years, it was a hard way forward. I buried 2 younger brothers who openly admitted about their addiction. I buried my mother who openly admitted about her addiction. She had been to some great services as well. But it's so so complex. There's no one person coming with one problem. The addiction, not in my experience, it's usually complex problems. And the bottom that I found, it's always covered in trauma. And when we're digging into trauma, the first thing that we teach, we need to drop the word blame, which is a very difficult thing. Remember, if you're coming into addiction, there's no honest people in addiction. None. How can you be an honest person when you're drinking and drugging and manipulating people and hurting your family, those we claim we love? Again, I'm talking from my own experience. So we've got a lot of help from the city, and we've got referrals from the social workers in the city in Limavady, Strabane, McGilligan Prison. Foyle Haven has been amazing. Refer people to the doctors to come off. Heard somebody talking, I think it was Desi, about prescription drugs. Out of over the 20 people in my group tomorrow, 4 may be on the alcohol. The rest is prescription drugs. Something that needs to be really addressed. And how do you stop young people from taking drugs? That's the question, isn't it? Can't go and blame parents. So I believe what Desi and other people are talking about, education and through schools and getting it early that there is people to turn to, professional people, counsellors in schools, where they can sit down and talk about the trauma at home or the trauma they're going through. I was in my own experience, I totally traumatized long before I ever found a drink. It's always the bottom line. What we're teaching in the 12 steps is step 4 and 5, trauma. We get rid of trauma, there's a good chance. There's a lot of successful stories in Heal the Hurt where people has been anointed many times and given up, and they're living clean and sober today. And as COVID slowly lifts, it's the people they're willing to give back their experiences. Public information meetings is very important. But again, we're not about anything else but we're on the ground 7 days a week. It's not 1 to 5 or Monday to Friday. We're there all the time trying to get back. We've took quite a few people off the bridge. We had phone call to Heal the Hurt, stuff like that. So the bottom line, there is lives being saved, but the trauma and what families are left behind to deal with, I really feel as much for them as I do for people in addiction. Traumatized parents, where they turn to and what they do, and then they blame themselves, which is very unfortunate. They go down that path of blame. So that's what we're doing. We're flat out doing our very best. Unfortunately, we haven't got the help that a lot of people here today has. It's me and one other counsellor's coming on board tomorrow. So, but we're seeing roughly 200 people a month. So the doors are open all the time. So I heard 3 or 4 times Denise and Liam and all talking about the word hope, and that's exactly why the door stays open, hope. So I'd like to thank everybody for inviting me on today, and I learned a lot. I've taken a lot of notes today from a lot of people, and I'll be making quite a few phone calls after this. So it was very, very productive for me and for Heal the Hurt. So I'll leave it at that, and I'll thank you very much.
Thank you, Liam, for that there. Thank you very much. And I totally agree with what you're saying there. You talk of death and so on. Fortunately, I lost a family member at the weekend to a suspected overdose. So I know what you mean.
Yeah.
I have to congratulate you on your 28-year journey, did you say?
Yeah.
From addiction. I know from speaking to people it's not easy, but I do believe that it's people like yourself who have gone through are able to talk of life experiences to these people, and I think people respect it more when they hear it coming from someone like yourself. So just
thank you very much.
In that there.
Thank you.
And I would just like to say, Dinula, also I've known a lot of people who have gone through the doors of Northlands, and these do provide a really great service. And keep up the good work. And Desi, I agree with you on the rise of prescription drugs. I'm a taxi driver. I see it all the time. I maybe lift someone and say, let's say Ballymac, for instance, and take them to a chemist on the waterside. Now they've passed about 4 or 5 chemists to get there. So you know what they're going for. You know what they're going on that shop. They're going on for because people know them in their local chemists and so on. And it's hard to see. It's not, and there's far too much of it in the town. But listen, I'm going to pass on to the rest of the councillors here, and thank you very much for your 3 presentations here. So first of all, we have Councillor Mellon.
Thank you very much, Chair, for letting me back again, and condolences to your family on the loss of your family member. Oh, can you hear me okay? Yeah?
Yep. Thanks. Really?
I just wanted to, first of all, congratulations to Desi and everyone at Hurt on their 20th anniversary of providing an excellent service in the city, and the Liam on our journey so far, and Dinola for the service that they also provide. I think what we've seen from today's meeting is, knowledge is power, and whenever that's not available to all of us, then some of us become more powerful in knowledge than others, and that really affects people's service and their ability they have a more fruitful life and a more holistic health. So my question is around how often does statutory services or people with statutory responsibility, how often is there outreach or partnership working out to yourselves and the community on the ground? I know that when working groups are set up, you know, there's also there's sometimes this notion of a tokenistic approach, you know, we'll hit somebody from the third sector and they see what they're thinking, but as an overarching kind of model, how often are you approached and they see what experiences are on the ground, you know, how much forgetting is being used, you know, are we overprescribing people, you know, things like that only used with the nature of your vocation, I'll call it, not a job, would have that information and them real life experiences. I do believe education is key, and that, as I say, where the knowledge is power. And I would just like to say, I know, you know, there's no conflict here. Everybody's of the same kind of hymn sheet. We all want better for our families, our friends. We come here as we have responsibilities and roles, but we're also living in these communities. They're our family, they're our friends, they're our neighbours. So we're very much invested in trying to do better for people. And I don't believe that the notion of, you know, any threat to a young person that they'll be tested in the morning or anything. I just have to say that part, that I do not believe that any of that would be productive in that model. Young people also have rights. And it's not about going down that road. It is about education and making informed decisions so that they then can assess risk. So I just thought I would add that part on it, but that's me. Thank you, Chair.
Thank you, Councillor Mellon. Councillor Doyle.
Thanks, Chair, and thanks to Liam, Nola, and Desi for coming. And this is exactly what I had in mind whenever I put this motion forward, because I don't know, you know, think about the expertise that you three have. You've probably forgotten more than I'll ever know about addiction and being able to help people. And this is the kind of stuff that we need to hear from time to time. And I suppose the big kind of thing that, I mean, we've talked a lot about, you know, in some of the other presentations about language, but one of the things that I think that people maybe need to know, I mean, I'll give you an example. I had a conversation with a family member recently. We were chatting about the town and going out and all the rest. You know, he's younger than me and a brother of mine, and said, Emmett, you've no idea how bad the drugs problem is in Derry. And I mean, I'm only 34. It wasn't a massive thing whenever I was running about the town at 17 and 18, for me at least. But I'd like to get a kind of an idea, particularly from yourself, Ian, how prevalent are we talking out there? Because I think people need to get a realization of how prevalent drugs are in the community, because I think we're way ahead in terms of a problem where people think we are. Because somebody mentioned earlier on about heroin, I think it was in relation to Foylehaven, and I know, having talked to people, that they would absolutely be mortified if you mentioned that there was a heroin problem in Derry that was growing. So I'd like to get that kind of overview as well. I do think that that's one of the messages that has to come from today, is there is a problem, but that there is support. Thanks very much.
Thank you, Councillor Doyle. Alderman Work.
Thank you, Chair. It's not really a question. It's for Daisy, Liam, and Noah, but many congratulations, Daisy. 20-year anniversary for her. And I'm going to be honest, from my heart, you have done a lot of work there in the community sectors, and all organisations have. Daisy, I've had you up in your club, and I can honestly say, as Liam was saying, it's given hope. You're saving lives. You're making a difference in lives. But as Liam was saying, Can you hear me, Chair? I think, Chair, your signal's really, really bad. It's cutting off, so it is. But as Liam was saying, it's in 9 weeks. The during the referrals, the waiting list. Where did he think people go? It's yous, people out there, or where people are saying us in the community sector, us as councillors, we're saying the news, and you are making a massive change, and it's unfortunate we're sitting here listening that you aren't hearing what the statutory services are giving out, you know, so there had to be obviously a communication, and I really do hope from this moment onwards there is more communication with your organisations out there, because you are actually right on the ground there, flat out, as Liam was saying, 24/7, you are on call. But from the bottom of my heart, I really do wish you all the best, and anything I know every council member here can help and do, we'll be there for you and support you, because you're making a big difference. I don't think the war's over, and we will continue to battle, so we won this one, but hopefully we make things better. But my vision, to be honest, I might as well say it, is we've a massive area down in Grantia, all these organisations bottle up in one, and have Detox Centre, have all the organisations there, and help and support everyone there. So thank you, Chair, for Liana. Wish us all the best. Liam, Desi, and Noah, thank you.
Thank you.
Thank you, Graham. And Councillor O'Neill.
Thank you, Chair, and thanks to Desi, Noah and Liam for your excellent presentations. Just the work that you do in the community is so invaluable, and it's completely based on care for the community. I think we really need to think about how we rebuild from this pandemic, and we want to rebuild a world and our communities based on that care, and I think you are the model for that. I currently work in the hospital, but I have also worked in the community and volunteer sector, and I understand the real disconnect, and it's like a structural disconnect between the community and volunteer sector and the primary care. And you know, I would be interested to find out, you know, more about your experiences of that disconnect or connect, you know, good and bad experiences, because I think there are some really good examples of that partnership working. And you know, your services are completely highly valued by our local community, but often undervalued by funders, and often you have to scrimp and to struggle to survive. So again, just a question just to discuss the challenges financially, that, you know, how this impacts the delivery of the essential services that you are delivering. But thank you again for all the work that you do.
Thank you.
Thank you, Councillor O'Neill. There's just one more, so I'll take Councillor Farrell, and then you could come in again then. Okay, Rory, go ahead.
Thanks, Chair. Had Rachel indicated that she wanted to speak? I think before me. Ladies first, etc. Rachel, do you want to come on?
Yeah, sorry about that. Apologies, Rachel. My that's all playing up today.
You're fine,
Go ahead
Chair.
then, Rachel.
And again, I may break up having issues too, but I wanted to thank Desi, Liam, and Noah again for today. I just wanted to touch on a few points. Obviously, Desi, you're talking about prescription drugs. It ties in so much with what Liam is saying with the trauma in the city and the troubles, and it's okay because, you know, the doctor gave it this, and we had this kind of mentality of it's trickled down. So it's something that does need to be kind of tackled, and I'm wondering whether or not you've seen any kind of difference with the likes of the rapid bins. I know we've only just got one of those in our rural area, and the numbers coming through that is, you know, it's surprising to see that people do proactively use them. So it's great to kind of get those drugs off the streets. The communication, I think that's key. You know, I think it's very much like the mental health services. There's so much community services out there, and then there's statutory services, but there's no link up. And like yourselves, addiction services, there's no kind of linked up communication. So people do have that idea, well, there's nothing there, or I was sent to the wrong place, or, you know, I got referred to the wrong place. So I think, having yourselves working alongside the statutory services is key in that communication. And then I suppose for me too, it's just to kind of find out, I know you are mainly based within the city and the district, but like coming from a rural village, it's so hidden, the drug misuse. That there's, people within the estates or the villages and stuff, and people don't talk about it. So it feels like a wee bit harder to reach. And I just wanted to kind of get your aspect on how you are coming across. Do you have outreach with like the local community groups out there? Are you doing talks and stuff? But again, thank you all for the amazing work you do. And it's been an education for me. I think all councillors should be kind of given a whole day on what services are out there and what's available, because there is a lot. Thank you.
Thank you, Rachel. Councillor Farrell.
Right, it's my turn now officially. Right, so thanks Daisy, thanks Nuala, thanks Liam, thanks for all the sterling work that you do for people across the city and district. I think we're blessed locally by having such fantastic organisations working in this sector. So if you probably all have wish lists about how we could improve services for people across this city and district. So I would ask, what would be your one thing that you would like to change? So each of you, if you could just answer that, just one key thing, what would be top of your list?
Well, can I answer that?
We're away. Well, up to the chair. But...
Yeah, go ahead. No, go ahead. Go ahead. It's good.
My wish list, and it's the same wish list that I've had for 20 years, is to have a one-stop shop where people who need addiction support locally don't have to travel, can access support when they need it without going onto a waiting list, and that they're then. I mean, I'm not sure how much you all know about Detox. Detox is a fairly short comparative journey that people will go through. It's all of the things that happen afterwards to help them stay substance free that is the key thing. So it's the wraparound services. So it's a one-stop shop. I believe that's the most important thing that we need. People don't want to be going from centre to centre, or they have to travel. And I really, if that was my wish, and if I had £1 million, I would offer it up to get that centre.
I'll just carry on with that question, if that's okay, Rory.
Yes, no, go ahead. Yep, go ahead.
Thank you for the question. Very much the focus, our future focus here at Northlands, is to see out the commitment of the new decade, new approach, the commitment to funding for a Northlands Addiction Centre within Derry, within the Northwest. That's been the vision of our founders for a long, long time. We have been here in Shepherd's Way temporarily for the last 25 years. We really believe the people of the city and the people of the north of Ireland deserves a purpose-built addiction treatment centre, which would involve not just our treatment programme, but all the wraparound services, which would be pre-treatment, which is after detox, when you need to get people when their motivation is high, get them in, pre-treatment, the treatment programme, and moving on services then, and aftercare services. So that would be number one on our wish list.
Thank you, Noah. And Liam? You're on mute there. You're on mute there, Liam.
Well, like now, okay. I'd have to second there what Desi says. What Desi says topped it for me, absolutely. That would be a dream come true. But absolutely, would a detox centre save lives? Absolutely. Is it the solution? Absolutely not. But a stepping stone to saving lives. They're badly, not only a detox centre needed here, needed about all around Northern Ireland detox centres. Where do you take? Listen, I have people coming to me, their mother lying totally in a bad. Where do they go? I was in England a few years ago fighting for a detox centre over the trying to get lottery funding. But again, when addiction, a lot of things falls on deaf ears when you come to addiction. You knock doors and try and open doors for addiction. The stigma is still hanging about, unfortunately.
Can I come in briefly, Chair?
Go ahead.
All right, cheers. Thanks for that. Really, really informative. But I'm going to be purely political here and address Nuala's query about the addiction centre. Obviously, this is our council's corporate position. We've written to the Secretary of State asking him when the hell is this going to happen. He hasn't responded yet. So we're patiently waiting for his response. But my party leader and Foyle MP, Colin Eastwood, actually pressed Brandon Lewis on the floor of the Houses of Parliament last week, asking him about this. So we're hoping there's going to be movement very quickly.
Thank you, Rory.
Thank you, Rory. And Councillor Barr.
Thank you, Chair. Like our councillor, I would like to thank everybody that gave up their time to make our presentation here today. I was impressed by Liam Stewart's presentation. One of his comments there, there's no war against drugs. Drugs is one of the hands down, resonated with me as I totally share those sentiments. But again, Liam's presentation, very frank and revealing, and I feel we have to listen to people like Liam. He's bought the T-shirt, wore the T-shirt and came out the other end and using his experiences very positively. I feel we have to sit up and take notice when we hear these empathic accounts from people like them. But I feel that the lack of government funding to some of these groups, like Heal the Hurt and Hurt, is something which badly needs to be addressed. And it's up to us as local reps to bring pressure to bear on those controlling the purse strings. Well, once again, thank you to everybody presented here today.
Thank you, Councillor Barr. And we'll just go back there to if there's Nuala and Liam want to answer any of those questions that was put. There wasn't many. I think it was more praise than anything, which is fully deserved.
Maybe if I could address the one about the linkage between statutory and community groups, if that's okay. We've been asking for closer collaborative working for a number of years. I don't really think this is the venue for us to kind of lash out at those statutory organisations. We feel that certainly there could be greater and more collaborative work. We haven't, to be honest, I've never met Liam. I know he's only in post a couple of years, but he does. I think he's open to the fact that we would work better together if we could help each other. So all I would say is that we could definitely have better collaborative working, and everybody is doing their best against as somebody mentioned, the tsunami of potential service users that we know are out there. Even since lockdown started, they left a number of weeks ago, we had a 20% increase in people accessing services. So we expect that to just get worse. So another time, maybe we could answer that question, but for now, we'd love to address that after lockdown eases and see if we can have better cooperation.
I'll just come back on that too, if that's okay. So Northlands is a regional addiction centre, so we work with all 5 health trusts. It'll not surprise you that the majority of the people who attend Northlands are from the Western Trust. And while there's always room for improvement, we're constantly working towards better referral pathways. I would consider us having, quite a good working relationship with Liam and the Trust. And I think especially in the last year, that's got even stronger. But as I say, there's always room for improvement.
Okay, thank you. No, Liam, do you want to come in there before we finish up there? You're on mute there still.
I think collectively everyone's doing their best, but like when you're facing an addiction, this is a monster, and it's very slow progress that we're even collectively together that we're making. Like it says, there's 41 people in my wee group dead. The youngest 19. The oldest is only 57. Sad, really. Since families devastated for life. So I'm very passionate at what I do. I don't get paid for what I do. We haven't received any funding whatsoever, but I'm doing it for a different reason. I'm genuinely in it to try and help people to the best of my ability. And for everyone who spoke today, if they're offering any kind of connection to heal the hurt and anything to help us or guide us in anything, it'll be well taken aboard. It'll be welcomed big time. I learned so much today about all these services. I'm writing lots of stuff right here. I'll be making a lot of phone calls the rest of the week. So it was very productive for me today. So I'd like to thank everybody.
Thank you, Liam. I think that's everyone now. I've no further questions. So I'd just like to thank Desi, Nuala and Liam for their presentations here. Thank you. They've been very thought-provoking there today, definitely. Listen, folks, I'm going to take a 5-minute comfort break before we've just 2 more presentations to go through then. So if we come back here at 25 past, is that okay with everyone? Yeah. Okay, everyone, we're all ready to begin again. We're home straight now, so you're all grand. So I'd like to move on now with Barbara McAtamney from the Department of Justice, who's Head of Crime and Community Safety. So Barbara, if you would, sorry, by the way, not introducing you earlier. I didn't realise you had joined the meeting at that stage. But if you'd like to go ahead there now with your presentation.
Okay, thank you, Chair. I'm hoping as well what I'm going to share with you now will maybe pick up on some of the questions that some of the committee members have raised as well. And I think that will help to show, I think, the joined up approach that I think many of us are working towards. I suppose to start off with is really just to acknowledge we know that drug use is one of the key drivers in relation to crime, and it can impact on behaviours which can make people feel vulnerable and unsafe, and then obviously become a potential victim. It can also influence people, I think, at risk of getting involved in or being pushed into those negative behaviours that then lead them to become a potential offender as well. I think the Department of Justice recognises that prevention and early intervention is actually the preferred approach to protecting people in communities as the department deals with the impact of a crime once it's actually taken place. So we recognise once it comes to our door, it's actually probably too late. So for that reason, the department is keen to play its role both at a strategic and an operational level in helping to address the wider societal issues that lead to substance harm and consequently then those community safety issues and increased crime. However, where that prevention and early intervention hasn't worked or it isn't appropriate because of the severity or the nature of the crime, it is important that the relevant agencies then have the necessary powers to ensure that action is taken where that's necessary. Enforcement can help remove the threat to community safety. It helps to ensure that the suitable and proportionate sanctions are action to those who don't respect the law. It provides a clear message to others on the consequences of their actions and acts as a deterrent. And then I think as well, it helps to enable that public confidence piece that the relevant agencies are bringing offenders to justice. So in terms of helping to support lead partners who deliver on this work, and you've heard from our health colleagues today, the underpinning approaches that we work towards are very much working collaboratively with the partners, such as health, to try and collectively identify the key issues, to address those links between the drug-taking behaviours and crime, and to tackle root causes of this offending behaviour, including what makes individuals more vulnerable or susceptible to harm. And then also linked to the primary objective of prevention is the importance of problem solving and identifying solutions that prevent problems reaching the point where individuals and communities need the help and support of services, and to help address those needs for the most vulnerable and frequent users of support. I suppose just at a strategic level, I just want to mention a couple of strategies that are important here. We work in partnership with the Department of Health, who lead on the development of the new strategy for alcohol and drugs, and you've heard about that in the earlier presentations. There's also a strong link between the substance misuse and use and mental health issues and those long-term illnesses. So whilst they're separate strategies, they very much need to be aligned with each other. And again, there's links then between the illicit supply of drugs and serious organised crime. So whilst restricting and disrupting the availability of illicit drugs is an important factor, there needs to be more of a greater emphasis on reducing the demand through that effective preventative drug education and provision of support services. So that's why it's important, just to say, to align the substance use strategy and the mental health strategy to ensure those right services are provided at the right time, so that the change is needed as early as possible, and that helps to break those cycle of behaviours. And that the Justice and the Health Ministers have been working to ensure those needs are also being met then within a custodial setting as well. One of the other strategies I just want to mention is that the department has recently launched a new organised crime strategy, and that's up until about 2024, and that has an overarching aim then of protecting individuals and communities and businesses from organised crime, including organised criminality, which is relating to drugs. That strategy highlights partners' commitment to enforcement, which includes organised criminality on the drug aspect. So it just gives you a feel of the work that's ongoing across the department with other partners at a strategic level. At an operational level, I can't go through all the examples just with the time that we have, but hopefully I just can give you, share some examples of that preventative and early intervention work, and as well as diversionary and recovery work that's happening at an operational level. And so I'll just mention some. I think the one I'd start off with, obviously, would be the policing and community safety partners. You may be aware that in terms of Derry and Strabane, PCSP, there's funding comes from the department and in partnership with the policing board, around about 442,000, between 441 and 42,000 for this funding year. And that funding then is used by the PCSP to help assist delivery of the action plan that has been put together by that makeup of political and independent partners, along with the designated organisations in that partnership. And that helps to provide any project support to a number of drug and alcohol and addiction initiatives with the focus on awareness, prevention and intervention, which is all aimed at addressing the harm caused by alcohol and drug misuse. One of the other approaches I just want to mention is our problem-solving justice approach, and there are a number of initiatives that sit beneath that. But basically, from a problem-solving justice perspective, it's about addressing harm and vulnerability at earliest stage as possible. And one of the initiatives that would include would be support hubs. I'm not sure how many of you would be familiar with them. There's one, with the exception of Belfast, in each of the council areas at the moment. And they form very much part of the department's problem-solving approach, which is there to help people who are vulnerable to harm from crime and to address those root causes of offending behaviour. They're very much deal with including addiction and related mental health issues, working with vulnerable people who have identified by partner agencies who are just on the cusp of entering the criminal justice system. So at the moment we would provide part financial support to cover the administrative cost of those partnerships. From a recent evaluation that we've actually just done on support hubs, addiction issues was one of the top 5 challenges that have been faced by clients referred to the Derry and Strabane support hub, and that would sit alongside things like adverse childhood experiences, loneliness, mental health problems and self-harm and suicide. So you get a feel how linked a lot of these issues are that we've heard about this afternoon. The support hub partners basically work together to improve the situation and well-being of each of those specific vulnerable individuals who give consent for those partners to work with them and to help improve their circumstances. And I think just up until recently, I think there were roughly about 61 referrals into the support hub in your area up until I think 2021. And 49 of those I think have been discharged this year due to their needs actually being met. So we have just done an evaluation, as I say, and certainly the feedback that we've got is that that's proving particularly successful in dealing with individual issues. One of the other issues that isn't actually in Derry at the moment, it's just a Belfast pilot, but I think it's just helpful to mention to you, it's part of the early intervention work so that we don't criminalise people, is substance misuse courts. So there's a pilot commenced on that in April 2018, and say that's very much that one of those innovative early intervention court programmes that targets people with alcohol and drugs related offending, and it aims to treat the individual and their risks and their needs. So I suppose if I could put it, there's a bit of a pause button whenever the person comes before the judge. Rather than sentencing them, they're given an opportunity to enter this programme to help hopefully reduce their alcohol and drug misuse, improve their mental health issues, and then obviously a reduction in their offending. And that programme takes place before sentencing is actually done. So I think there's a second phase of that pilot has just started. So before it would be rolled out, that will be evaluated, say in terms of Belfast. There's obviously a role for the department through the work that we need to do in relation to enforcement and disruption. And a lot of that work would be done through the Organised Crime Task Force, which is there to disrupt importation, supply and distribution of illegal drugs. And there's also a joint agency task force, which is partnership working in terms of cross-border, which is there to tackle the organised and cross-jurisdictional crime on 6 priority areas, which also includes illegal drugs. The Paramilitary Crime Task Force, again, is a specific resource which focuses on protecting communities from criminal behaviour of paramilitary groups, which includes obviously the supply of drugs into those communities. And part of that work includes seizing assets of those supplying drugs and taxing the proceeds of drugs related crime. I think then moving on to the sort of recovery and reducing offending and rehabilitation work that goes on with throughout the department and with partners. I suppose it's just to acknowledge that there's a range of social economic factors which obviously have been shown that impacts on reoffending, including substance misuse. There's a significant number of people who come into contact with the justice system who have unmet health needs and substance use issues. And a proportion of those people will be committed to our prisons. I think as of the 1st of May this year, 54% of our overall prison population have been recorded as having an addiction. So that just shows you obviously that the level that we're dealing with. And 71% of those within prison custodial care have reported using drugs at some stage in their life, with I think 67% feeling that alcohol or drug use has contributed to their offending. So say it, as I said at the start, it very much shows that there is, drug use can be a key driver in terms of crime-related incidents. And obviously that's all linked to mental health, because 33% of those were in contact with mental health services or had a psychiatric admission prior to custody. So for those who commit crime and who are affected by it, a custodial sentence does remain an important part of the criminal justice process. However, we would say a key element of any sentence must be to focus on enabling offenders to reform, so they're given every opportunity possible to address their offending behaviour. So prisons would very much take a person-centred approach in terms of that rehabilitation, about providing positive and constructive relationships. And addressing reoffending not only means tackling those issues, but also creating the positive connections back into supportive families and communities to try and sort of, I think, provide those enablers of change. You've heard, I think, the first presentation talked about, and from the PHA as well, talking about the addiction services that they provide, and that is extended through the South East Health and Social Care Trust for prisoners in Northern Ireland. So as well as having the specialist addiction staff within the healthcare teams at each establishment, the Trust then commissions the Start 360 that you heard about to provide drug counselling and those therapeutic interventions on their behalf. So prisons will very much come at it from a three-strand approach. It's based on deter, detect, educate, and part of that will include drug testing. So I suppose just to conclude really, before happy to take any questions, I think probably the key message that I think I'd like to leave today is that this is a multi-agency approach, and that working in partnership with communities to try and empower that change and build resilience and support delivery by utilising all of the local skills and knowledge is extremely important. Local communities understand, I think, more than anyone, the specific needs and solutions to building the community resilience and addressing those issues within that area. And I think we've heard that from a couple of the presentations today, the importance of that. What we're keen to work with is how can we build up those appropriate mechanisms to ensure that there's the feedback loops between local government, the delivery agents and central government, which is needed to be developed and to maintain those clear links, particularly into things like community planning. That local feedback can help drive central government strategies and policies in terms of what the sort of the wider needs are that need to be addressed with. And that helps to ensure basically that every contact counts to help reduce the harm and vulnerability, and hopefully the chances of people becoming, sort of reducing those chances of people becoming victims, offenders, or indeed both. So, Chair, I hope that helps to tie up some maybe of the presentations and some of the questions that we've heard this afternoon.
Thank you, Barbara. Very detailed there. So it was. Listen, I'm going to take William Calderwood's presentation as well, and then we'll take questions from the members. And so if Chief Inspector William Calderwood would like to join us there and take the stand.
Yes, thank you, Chair, and thank you to everyone for having me today, and a big thanks to all our speakers for the presentations. For those who don't know me, my name's Willie Calderwood, and I'm the new Chief Inspector, Engagement Chief Inspector for Derry City and Strabane. I am also vulnerability lead for the area. It's clear from other speakers and everybody's input today that drugs and alcohol present a real danger to our communities. And as new Chief Inspector for the area, I would like to take this opportunity to reiterate our commitment to arresting and charging those who are causing harm, the suppliers and the dealers. Every day, officers in Derry City and Strabane are focused on their efforts on those involved in the sale and supply of illegal and dangerous drugs. Sadly, there's very few areas where people are not affected by the selling of and misuse of drugs. However, we recognise the importance of working alongside other agencies to support those people who are vulnerable and being exploited for criminal gain. Many of the issues that we come across, many of the issues facing the people we come in contact with will not be solved by a criminal justice response, and we have a collective responsibility to ensure that those who need support can get access to it. And at the same time, we will continue to be robust in our actions to keep people safe. And I want to give you reassurance that we will remain committed to tackling crime, to making the community safer, and focusing our efforts on those who cause the most harm. Locally, we really do that in 3 different ways. The first way is through enforcement. The police service is, of course, responsible for safeguarding and protecting the public from a range of threats and harm. Drug use clearly representing one of the harms. Not only are people motivated at times to commit crime to fund drug use, but drug use itself can drive criminal behaviour and harm in the form of exploitation, violent crime and neglect, to name a few. To put this into context, in the financial year 2019 to 2020, there were 7,451 crimes in Derry City and Strabane area, with approximately 12% of these drug related. So tackling drugs misuse continues to be a local priority for Derry City and Strabane, which is reflected in our performance figures. In Derry City and Strabane, there was 442 arrests for drug related crime in 2020, which is an increase of 10% on 2019, which is also the highest in any of the other areas in Northern Ireland. So that's the first strand. But when we talk about enforcement, it's really important to me and it's really important to my officers that actually when we are enforcing, that we are procedurally fair in everything that we do, understanding that trauma is involved in a lot of the people that we come into contact with, and it's really, really important that we are proportionate, we're fair, and we're sensitive in any of the action we take. And this leads on to the second strand, is about problem solving and working together with our partners. It's through partnership working that we are able to be more effective in identifying threat, harm and risk, and therefore I'm able to focus my resources on where they need to be. Likewise, and from working with partners, the information that we hold locally from officers on the ground, from anecdotal information is also vital to our partners to ensure that we really understand what is going on and we work together to address the needs of the community. Evidence is clear and is showing that effective community engagement, targeted activity and collaborative problem solving with partners can significantly increase confidence in policing. A lot of our partnership work has already been mentioned, so I won't go into too much detail. Of course, we have the WDAC, the Western Drugs and Alcohol Coordination Team. We are active members within this group. We also actively attend the WDAC Drugs Harm Information Exchange, where we actively exchange information in an attempt to work together to address issues. We also have the City Centre, Derry City and Strabane District Civic Forum. This is led by the presiding mayor of Derry City and Strabane and works to address issues relating to alcohol, drugs, emotional well-being and suicide prevention and homelessness. Rapid bins were also mentioned, which stands for Remove All Prescription and Illegal Drugs. This is a community-led initiative supported regionally by the PSNI and Public Health Agency, and again allows us to focus, allows us to understand and get more information about what drugs are out there, and again to let us focus and address issues and come up with collaborative solutions. And the third strand is all around harm reduction and addressing vulnerability. It is vital that we help to prevent drug misuse in our communities and support people dependent on drugs through treatment and recovery. Vulnerability is everyone's business. And locally we promote this to every officer and staff in Derry City and Strabane. We have a local vulnerability strategy in place with emphasis on trauma-informed approach. For your local officers, this means we respond, recognise and respond to vulnerability. We acknowledge that mental health can impact across all forms of vulnerability, including substance misuse, and we ensure that all staff know where and how to access service provisions for all strands of vulnerability, especially at a local neighbourhood level. Locally, all officers have been trained to recognise and respond to adverse childhood experiences. This was a training session piloted and developed in Derry City and Strabane. This is now progressed in other areas within the PSNI are now using this training to teach officers to respond, to understand vulnerability and seek out help. For us, it's about early intervention. It's about getting to the root cause and working with their partners to get people the help that they need at the earliest opportunity. Locally, we've also initiated a vulnerability navigator. This is a new role specifically to Derry City and Strabane and only one other area. And again, that's to help identify vulnerability on every occasion, to understand that I believe it's nearly 40% of our calls relate to someone with identified vulnerability. The support hub was mentioned. The support hub is a platform for complex interagency working for those most at risk. However, like everything, there's a threshold, so it only has the capacity to deal with those at the highest end of the spectrum. So our local vulnerability navigator reaches out, and it was really refreshing hearing from Desi, Nola and Liam. And moving forward, it would be I would like to get my vulnerability navigator to meet with you, because his role is to look at our calls, phone people back, have honest conversations and explain to them that actually there's help out there, and signpost and refer to help get them the help, to help them to stop them from being exploited, to prevent them to being repeat victims. So that's a huge role for us, and as I said, that's a new role. In the last 3 months, I believe he's referred 25 people specifically to drugs to support partners to get them the help that they need. So there's 3 strands, just to quickly go over it. It's enforcement, but being procedurally fair. It's about working with their partners to understand actually what the risks are, so we can focus our efforts where we need to be, where the real risk is. And finally, it's about vulnerability, and I'll repeat it again because it's really important to us locally that vulnerability is everyone's business, and we will do everything that we can to help people to understand the root causes of their problems and work collaboratively to get them the help that they need. Thank you, Chair.
Thank you, Chief Inspector. Members, now I have Councillor Doyle is first on the list there. So, Emmett, do you want to go ahead there?
Thanks, Chair. I suppose this was a balance whenever I brought this motion forward, because we want to hear about the support that people are able to get, but there is also that enforcement piece as well, because there are people out there who are providing drugs, those death dealers who are making a profit and who are making a living off the back of misery, and we have to address that as part of the wider problem as well. So we'll have a number of, I suppose, difficult questions, and I appreciate both of the previous speakers coming and giving us an insight into their work. Firstly, I suppose, Barbara, thanks for coming. I suppose, look, one of the biggest issues that I see around the place, and that it comes to me, and I'm sure there'll be a wide range of members would agree with me, is that there does seem to be more and more stories that I read in the local press who will, when there's someone arrested for a drugs-related offence, for example, we find that they have dozens and dozens of previous convictions. And that obviously has an impact in terms of the confidence that the community has that these people are being dealt with. And some of them are very serious. Some of them nearly you could name. And that's the stage we're getting to in Derry. And I've had a look at some of the figures, and I've noticed that the rate of custodial sentence imposed at every court level, from the most recent statistics from the Department of Justice, was only 14.3%. So there's only 14.3% of people who have been lawfully charged with having some form of drugs offence committed are getting a custodial sentence. Now, I'm not here to criminalise or tell people that everybody has to go to jail. That's not the way it is, but that would be of a concern. Also, I know that a quarter of all the divisionary disposals which many of the people around this city would see as a slap on the wrist, in 2019 were for drugs, but actually 90% of those diversionary disposals were cautions. So again, there's a real disparity between what I think people want to see, especially in relation to repeat offenders, especially in relation to those who are involved in very much organised operations. And then we see these people running around the town with 50, 60, 70, 80 different convictions, many of which are drug related, many of which could be contributory to their drugs convictions. And there's a real problem there growing, and I think a lot of us recognise that in the community. So I'd like to hear about maybe some work around that. And Chief Inspector, again, thanks for coming. One of the reasons that I brought the original motion forward here is because the statistics, particularly around cocaine, scared the hell out of me. You know, the seizure of Class A drugs has been rising every year since 2006. The number of drug offences recorded from 1819 is now 6 times higher than 2001 and 2, and the highest level ever since 1998. So there is, obviously, I recognise that there's an issue that it needs to be addressed on a range of areas, but it does come down to, you know, the police need to be doing more out and about in the community, because there isn't a bar that I haven't set foot in at some point or another in the very recent past where it wasn't fairly obvious that people in the bar were able to have access to drugs. And I raised that at the original motion. And the other, you know, very serious question that I have for you, Chief Inspector, is people need to know that when you're involved in crime, when you're involved in organised crime, that you will be dealt with by the criminal justice system. So I have to ask you, are there people who are being used as covert human intelligence sources in Derry by the police that are involved in the drugs trade? And I ask that for a very simple reason. There are a number of groups, individuals, whatever you want to call them, who are seemingly untouchable in this city and district when it comes to the supply of drugs. I'm sure I don't need to tell you about the impact that that has on the community, but obviously there are people who come to me on a regular basis and say, such and such has been at it again. The police have been up to the door and nothing ever happens. So I think it's a legitimate question, and I would appreciate an answer if possible. Thanks very much, Chair. Thank you.
Thank you, Councillor Doyle. Councillor Ferguson next.
Thank you, Chair, and thank you, Barbara, for your presentation. I know this is something I've spoken with the Minister before about, and you know, she's very aware that the justice system is the last strand of a bigger problem, and we need to have more prevention and engage with other statutory bodies before a victim or even a user engages the system. I know from speaking with Siobhan O'Neill, the mental health champion, that there were a number of intense programs within the present system that she thought were really, really good. But I think my worry here is, like previous speakers, the ones that then come out back into, you know, day-to-day life and don't necessarily have that wraparound intenseness. You know, I wanted to see if there was something that is there programs in which that they can tie into whenever they've been through those intense programs within the justice system and then brought back into their day-to-day life. And then Chief Inspector William, thank you very much for coming. And again, the vulnerability officers, I think that's a fantastic initiative and one that I've had a few interactions with. It's great for being trauma informed. I just wanted to touch on how it's currently working. You know, is it something that you're hoping to continue? I know I touched base with one today because of a possible domestic violence case, and you know, I think having those, as we said previously, having those links with the community and statutory sector is amazing. You know, someone who will look back on the calls and go, do you know what, there's a community group that can help you with this, or there's a domestic violence group that can help you with that, or there's a referral with drugs. So I do think it's something that is a proactive step, and I think it's something that possibly we need across all our cities and districts. So I just wanted to get you to touch on that a bit more, but thank you both for today.
Thank you, Councillor Ferguson. Councillor Mellon.
Thank you, Chair, for letting me in. Welcome to you both to the committee. I suppose my question for the Department of Justice and for the police is, what measures are being put in place to safeguard children from criminal exploitation? I know there is CRNs and there's, you know, the resolution notices and stuff, and there's a youth justice there, but as a victim of criminal exploitation, when we see children at 14, 15, 16 supplying drugs, it is quite evident that they are a victim of exploitation. So what process or what measures are put in place for them children and young people before they get to that stage even?
Okay, thank you, Councillor Mellon. And Councillor Barr.
Thank you, Chair. Councillor Doyle more or less covered everything that I wanted to say, you know, and I just want to associate myself with every comment he made, particularly the last question that he asked. And I would ask that question to you. As a blind eye being turned to some drug dealers for what would be termed the greater good?
Okay, thank you, Councillor Barr. I have no other indicated speakers, so I'll return to Barbara and Wally. So you can answer the questions there now, to the best of your ability.
Thank you, Chair. I think that there's maybe a couple of ones. Just forgive me if I've missed a couple. I'll try and pick up on what you've or what I have heard. So I think in terms of the drug-related arrests and custodial sentence issue, I don't think it will probably surprise committee members to know that obviously the judiciary, with them being independent, obviously we have, you know, we can't control what sentencing they give for someone who comes before the courts. I suppose I can just give you reassurance that obviously that there are sentencing reviews on a regular basis, and actually we're going through one of those at the moment. So we've had an opportunity to seek views from members of the public and interested organisations on what sentencing review issues that there needs to be. So I think we'll wait and see. The outcome of that should be known quite soon, actually, and there'll be new legislation being brought forward within the next mandate to address particular issues. I think in terms of, though, with regards to diversionary disposals and cautions and repeat offenders, there's definitely an issue there. I mean, I fully understand the point that was made in terms of, you know, public perception, and there is definitely an issue with regards to how do we ensure that the rule of law is seen to be upheld and that we maintain public confidence in the justice system and the decisions that are made, and that those decisions are as transparent as they possibly can be. Again, I would say because the sort of sentences are independent through the judiciary, that they may say that, you know, that the reasons behind those decisions being made are not always made known to people, and therefore they're not being picked up in the press. But I think there's definitely something that we could do more in terms of the messaging around that, and explaining what mechanisms are used, for who they're used, what the benefits may be to the wider community, as well as individual victims. And some of that is being dealt with, you know, through obviously taking the views of victims and what they feel is the best approach. Some members may be aware, you know, that there's work going on as well within the department in terms of the restorative justice approach, where we do have individual victims whose preference is that actually an offender is dealt with in a particular way. And obviously the offender needs to agree with regards to that. I think that approach can sometimes be seen as an easy option. I think from feedback of people who have gone through that approach, which is mainly under 18s at the moment, would indicate that it's not an easy option. but those are currently being explored in relation to adults at the moment as well. In terms of the, I think it was comment about the mental health champion and the wraparound service with regards to programmes that are going on within the criminal justice system. There is a range, obviously, of social issues which are shown, obviously, to have impacted on offending, and that includes the poverty and the social deprivation, mental health issues, homelessness, lack of educational attainment, employment opportunities, and that's just sort of a typical profile of some people who do end up within the care within the prison service. So those are factors that contribute towards the reasons why people become involved in crime in the first place. So addressing reoffending doesn't just mean tackling those issues, but it does mean about how do we create positive connections, as I said before, back into supportive families and communities. So there's a number of approaches that are taken to provide that wraparound service when someone is within the custodial setting after they have gone through that sentencing process. You know, for example, things would include you know, looking at accommodation, for example, and the needs of offenders, making sure that they've got a safe place to live, which helps obviously to contribute towards someone moving away from offending behaviour. So that would include working with the Department for Communities and the Housing Executive to help improve the support of offenders once they return to the community. Things as well in terms of helping to access opportunities for education and employment. So it's how do we increase that access to and the readiness of employment again for people who have offended, ensure then that they're actually able to apply for jobs when they leave the justice system, because that obviously makes it more likely for them to have stability in their lives to try and refrain from further offending. Improving the health provision within the criminal justice system is important as well. So I've illustrated sort of, you know, a number of offenders and their underlying health issues that they would have. So we've been working with health and looking at those outcomes for people in the criminal justice system and how we collaborate with the social care professionals to improve those services for people within our prison care. So that's just sort of an example of the types of wraparound service. I think the other question then, I think, was around measures in terms of safeguarding children and that early intervention approach. I suppose, again, just to give you examples of work that's ongoing there. And I think actually it'd be helpful just to maybe outline some of that as part of the COVID environment too. So it was mentioned, obviously, we do have the Youth Justice Agency, who would be our key agency that would work with children. At the moment, there's a piece of work going on again with the Department of Health on bringing together a joint care and justice sort of the facilities that we have in Bangor. So it's providing that, I think that streamline between, because we have individuals, you know, unfortunately some young people who do sort of flip-flop between the care system and then the youth justice system. So that's one facility that's coming together to try and provide that more sort of streamlined and collaborative approach, so that individual really sort of is getting consistency in the support and the help that they need. We also actually at the moment are in the process of looking at an early intervention schools programme. Again, working through the likes of Youth Justice Agency and different partners, for example, education. We're looking at what actual awareness raising is going on at school, what ages are they targeted at, what is the, I think, the acknowledgement of schools and actually the uptake of those awareness raising programmes being offered. So we're just looking at that at the moment to get a feel for what sort of mapping is out there, what is the service uptake, making sure there's no duplication and that the funding that goes into that has actually been targeted in the right places and at the right schools. You know, so coming at it from a place-based perspective, are there certain areas that maybe need those facilities more than others, and obviously raising the awareness of the consequences of drug and alcohol use is a big part of that. There's a number of programmes within the Tackling Paramilitary programme specifically aimed at youth as well, and sort of picking up on those, I think, young people who would be at higher risk of influence. And the other thing just to mention to say, as part of the COVID, there was a specific PSNI-led group that actually was set up of multi-partners looking at collectively preventing harm. So identifying those particular individuals who maybe have become unsighted at the moment because the services just have not been as operational as they would be pre-COVID. So how can we identify those individuals? And working with a number of those partners, they have been able to identify particular groups of people and hopefully then address them through sort of particular initiatives in this COVID environment. And linked to that, I think a couple of times it's been mentioned, about the links with social deprivation. So linked to that would be, we found a big issue, for example, during the past year has been an increase in food and fuel poverty. So identifying those young people who are maybe in families who are experiencing those issues, who potentially are also experiencing high domestic violence within the home. And unfortunately, they're no longer then in schools for teachers or support services to be able to pick up on particular issues and help them. So that was a piece of work that has been going on during COVID as well. I hope I've covered all of the questions that had been asked.
That's covered everything there. Barbara, well, if you want to come on there now.
Yep, thank you, Chair, and thank you everyone for your questions. I'll start with the question around the covert drug informant query. I'm unable to address that as much as I would like to. I don't know. As a district policing command, my priorities is around providing first-class service to the community, identifying vulnerability and seeking confidence from the community. There is platforms in place such as the policing board. If members would like to take specific concerns to that platform, and that's where that can be addressed, but locally I'm unable to be in a position to address it. In regards to other queries, firstly the court system, all I can say is and try to give reassurance that as our roles as police officers, we will gather best evidence, we will identify risk, and we will put everything to the PPS to make decisions around prosecution, who will then try to lead the prosecution in the criminal justice system. We are out of the loop. All we can do is our recommendations, put the evidence in front of the criminal justice system, and they make the decision around sentencing. We are not involved in that from a policing point of view. Diversionary disposals. Again, these are set in place to understand, actually, it's not at times by criminalising people. Diversions are in place to ensure that we are procedurally fair, we're supporting people, and actually we are proportionate in all our actions. However, with a lot of the diversionary disposals, you can only get it once, so there shouldn't be people with reams of disposals. You get it. If it happens again, then a lot of the times you're not eligible for a disposal. In regards to licensing, I'm aware that this may become an issue as the regulations loosen. Again, all I can do is give you the reassurance that there's heavy engagement. We have a licensing officer in place who looks at licensing, who engages with all our public houses and works closely with the council environmental health to ensure actually premises are being run as they should. And again, that's very much a collaborative approach. We have increased our neighbourhood teams over the last few years, so we have more neighbourhood officers than we've ever had who are out there engaging with the community. If there is issues within bars, again, we will address it. The information needs to come back to us to allow us to take action. But again, you have my assurances that if there is issues, then we will work to address it with our neighbourhood teams, with local community reps, or with other statutory agencies, whoever it may be. And again, in regards to turning a blind eye, we don't turn a blind eye on crime. It's that simple. We investigate crime, and we are robust and proactive in regards to bringing those who are creating most harm to our communities to justice, and we will continue to do that. In regards to the vulnerability navigator, it's working very well. It's still evolving. It's a completely new role, so it's still evolving. It is about actually reaching out for us to understand what services are available and to make sure that our officers understand the pathways available to them. It's confusing to many of our community members what helps out there, it's just as confusing to us as well. So it's about getting everything on the plate, understanding, and that will continue to evolve. But from the people we phone back, in the region of 50 or 60% of the people are accepting either signposting or referring. Now, everything we do is with consent, so we can make the phone calls, we can try and help people and offer them the help. If they refuse, then we can't share details and we won't do that. However, it's amazing actually by just phoning back, checking that they're okay and having that conversation and actually making them aware of what help is out there. That's how many people are taking it. So that is something that I will keep in place locally. It's huge value for us. And again, it promotes that collaborative working and that early intervention is by getting people the help that they need before actually it reaches to a level where we're looking at the support hub threshold. In regards to the welfare of young people, I mean, the welfare of young people is absolutely paramount to us. The risk out there is huge. It was highlighted, especially over COVID and lockdowns. Any risks already there were compounded because young people weren't going to schools. They were in behind doors, and very much like domestic violence, that threats became hidden to us. A lot of the indicators became hidden to us. So I was one of the officers involved in rolling out the district response in regards to identifying, supporting our partners in regards to looking after young people most at risk within our community. So we work very closely with our public protection branch, who on a bi-weekly basis, they work with the trust and they give us details of young people who are at particular risk within our community. We pass them details to our youth diversion officers who do some research, who works collaboratively, and we share them details with our officers on the ground, so everyone's aware of the risk. That actually, if we identify a person when they're out, we try to understand who they're with, what they're doing, to ensure that we have a grip around that, because the risks to young people are absolutely huge at the minute. And we do work very closely with our partners in EA, with the council, and we will continue to do what we can for the best interest of the young people within our community. And you have my absolute assurances that that is the forefront of everything that we do, and that will continue. But again, we can't do that by ourselves. We need the support of yourselves, of our partners, and we'll do whatever it takes to keep our young people safe. I think that I've probably missed one of the questions. I went through my page. If I have missed anything, please let me know and I will address it.
Well, thank you for that there. I think that was everything covered, but I'll go on there to Alderman Hussey.
Thank you, Chair. Before the extremely impressed with the very honest, very I say congratulations and going forward.
Derek, can I just come on there? Does anybody else hear Derek cutting up there, or is it only me?
Cherry's cutting out.
Turn your video off there, Derek. Just.
Oh. I can't get it turned off. Is that any better?
Does that
sound any better now? Okay. What I was saying there was, come on to the last two presentations. I just wanted to thank Liam for a very thoughtful presentation and congratulate him on the work that he's doing and wish him best wishes going forward. Thank you, Liam. With regard then to the actual presentation, I mean, I have a great deal of empathy from what we heard from Councillor Doyle and indeed from Councillor Barr Raymond. The issues that they raised, reference confidence, aren't just city issues, they're also rural issues. And I would regularly hear the sort of comments that Councillor Doyle referred to. All too often we hear dogs in the street, no, but I would agree that dogs in the street can give evidence when they're happening. The kind of confidence and a lack of a perception of wrongdoers not being dealt with properly lead to an underreporting. And that is something I don't know how that carried forward. Perhaps the chief can elaborate on that. Are there any means by which that area of competence can be improved, avoid the underreporting, and reinstill that confidence within our community? The number of times that people say to me, "So there's no point in reporting it, nothing's going to be done about it," and that is a credible situation. The real question I wanted to get to then, as a border, I'm in here in Castlederry, a community along the border, there is strong likelihood and big suspicion that a lot of the drug trade would be cross-border. Could they? Is there is there cooperation with Garda Síochána going forward on drug supply lines? And if so, is it being found to be successful in helping in some way to avoid drugs being in our business? Thank you to the presenters.
Okay, thank you, Alderman Hussey. Councillor Mellon, you just wanted to ask a quick question there, did you?
Thank you, Chair. It was just raised in relation to the accommodation for people who have offended and they're come back out in the community. We often see people that are from outside of the area coming into temporary accommodation, and no, we don't have enough suitable supported accommodation for those coming out of the criminal justice system. Apologies, that's two children in the background if you can hear them. But it was really how much work is being done in association with the housing associations and yourselves, so that people are going to suitable supported accommodation. I'll give one example of the B&Bs that's being used within the city for people coming out of being incarcerated, and families with small children are there as well, and there's added risk being given to members of the public, and also the support not there for the person as well. So it's a double-edged sword, really.
Okay, thank you, Councillor Mellon. And the last one, Councillor Harkin.
Thank you, Chair. Yeah, it's been a long meeting and very, very useful. And I decided to stay because I wanted to get on record what I think are some points I think will be counter to some of the proposals that I'm hearing, which I think are kind of lead the dog whistle kind of law and order proposals. One of them is, we hear that you go into a bar and there's drugs available. Well, you go into a bar and there's alcohol available, and from all the stats I looked at, alcohol is still the #1 killer. It's still the biggest challenge that we face in our communities, whether it's addiction, domestic abuse, and a whole range of other problems. But the solution there is not criminalisation and incarceration. And I think we just have to put all this in perspective. Number two, we're asked about safeguarding from the police for children. When our council has been discussing the police attacking children, 14-year-old autistic children in Craigan, we see the police fining and violating the rights of black children going to Black Lives Matter protests. I mean, we have to get this is what I mean about counterpoints. We talk about safeguarding. We just voted in our council against spy cops. Spy cops is where the police are shown to be taking advantage of people, exploiting vulnerable people. They want to legalize it. I mean, let's put that into context, because we're not getting honest answers here. We're told I can't answer that question, and that's a key question. Of course, that's happening. And again, I mentioned decriminalization earlier. The US, as everybody knows, is the country with the greatest amount of drug use, both prescription and otherwise. And have spent billions and billions and billions of pounds on policing and incarcerating people and having the largest population per ratio of in prison. And everybody then concluded that the war on drugs failed. And what are they doing now? They've decriminalised cannabis use and are looking at other drugs as well. And we are talking about going down the route of the US, which is a failed strategy. Policing and law and order did not work. Education, treating it as a health issue more than else, everything else. And this is why people are saying we actually need to fund, put our resources towards ending deprivation and impoverishment rather than throwing more and more resources at the police, because that's been a failed strategy. Now, I'm not asking for the police, the inspector, or for the Department of Justice to answer these questions. These are counterpoints, because in the outside world, outside of some dog whistle arguments, these are the debates that are happening about this issue around the world, which is not to reduce the importance of and the seriousness of what's happening in our communities, but we have to actually look at other solutions that people who've been further down this road than us have been forced to grapple with. Thank you, Chair.
Mr. Harkin. So Barbara, well, I'd like to come back in there again. There's no more questions there now, so you'll be glad to hear that.
Yeah, thank you, Chair. Okay, I'll answer those to the best of my ability, coming at it from a policy perspective. So obviously, I wouldn't have sort of operational on the ground knowledge for some of those issues. As I say, maybe just looking at the sort of the confidence issue, and I think that was one of the things I acknowledged. I think in my earlier presentation was that we know there is a need to keep building the knowledge of the public, because we recognise that public confidence leads to increased reporting. The two go hand in hand, and in order to get increased reporting, the public like and need to see results. So obviously, as part of the numerous reviews that are being done throughout the criminal justice system, they're all aimed at improving the criminal justice system to be able to provide that. So it goes back to really, I think, to what I said to one of the earlier questions around the messaging. There are a lot of, I think, tools in the toolbox for the law enforcement agencies to be able to use to address this. Some are probably more widely known to the public than others. So I think there's a messaging that we need to probably work on more to sort of raise the awareness, I think, of what those sort of tools are and what they're for. The one thing I would say, though, as well, and we would ask all councils and agencies to promote it, is the Crime Stoppers, which is out there. It's an anonymous number. It's no one is identifiable through it in any way at all. So if anyone does have any information about any particular crime or information in relation to drugs, we would encourage them that if they don't feel confident and able to go directly to the police, that we would definitely encourage them to report that information through the Crime Stoppers. As I said, no one will know where that information came from, but it's information that the police and others are able to use and to gather to build up that bigger picture, to be able to hopefully address the concerns that individual or the community has. I think in terms of then the issue in relation to crime and sort of the border and drugs trades issue. Again, I'd mentioned the key role through the work of the Organised Crime Task Force. There's a drugs subgroup. It's chaired by a senior PSNI officer, and it works closely with partner organisations to disrupt that importation and supply and distribution of illegal drugs. So there's a combined effort of the OCTF partners and to make use of the available legislation that's there to detect and intercept those illicit drugs before they can reach the communities within Northern Ireland. And in addition to that, well, I think from an operational partnership work, and it's often evidenced in the media. For example, I think in September 2020, the PSNI, working in collaboration with the NCA, were able to successfully remove, I think it was £1 million of cocaine from drugs from entering the Northern Ireland supply. And that investigation was supported throughout by the Garda. But there's also then the joint agency task force, which is cross-border. It's an operational task force, and it was established following the Fresh Start Agreement as part of that effort to tackle the organised and cross-jurisdictional crime. It works on 6 priority areas, and one of them is illegal drugs. There was a question in relation to accommodation and about whether or not the accommodation is suitable. And forgive me, I'm not close enough to the issues within prisons to be able to give you a full answer with regards to that, other than just to be able to confirm. I do know that accommodation is one of the sort of wider wraparound services that they're trying to provide to ensure that there's stability there for the person whenever they leave that establishment and going back into the community. And I do know they work with housing authorities, the relevant housing authorities, as to where that relevant accommodation should be and what safeguards are put in place. So there are risk assessments there whenever those are decisions been made. But apologies, I just don't have, I'm not close enough operationally to know exactly the detail in relation to that. And I'm happy just to say, I know there was a couple of comments at the end there that you weren't actually expecting us necessarily to address, but one was just in relation to the decriminalisation of cannabis. And it's really just, I suppose, to confirm, as I say, that as mentioned already during the presentations earlier today from Health, they're leading on the substance use strategy. At the moment, they've just finalised that consultation and they're working through the responses. And those are the kinds of issues that piece of work is looking at. But just in terms of the legislation on drugs is actually a reserved matter. So it's not, those are things that are not something that Northern Ireland can necessarily legislate on in its entirety. So just wanted to share that information with you.
Okay, thank you, Barbara. Willie there now? You want to come in?
Yes, thank you, Chair, and thank you for all the questions. In regards to Councillor Hussey's question around perception of people getting off with crime, how that impacts underreporting and confidence in policing, I couldn't agree more. It's vital that we are accountable to the community. We work for the community. And if we are failing them, or if there's a perception of that we're failing them, then that will impact confidence in policing, and that will impact underreporting, and that will impact our ability to keep people safe. So if that is the perception, and that's what's happening, as new engagement chief inspector, you have my assurances that I will do everything in my power to fix it. The fact of the matter is, if people report crime to us, then we will investigate it. In ways around it, there is the new communication board being, or with WDAC. If there's a way to get the information out there, if there's a way for us to be more transparent, then we need to be doing that, because we need people to report crime to police. At times we may get something wrong, but we will be accountable for that, whether it's through PCSP, the policing board, or even these platforms. And it is important that we are accountable. It's important that we hear the issues, that we hear that confidence in policing needs to improve. And you have my assurances that we will continue to listen, and we will continue to do everything that we can. But again, the whole issue around drugs and alcohol, it's not a policing issue. So it's not a solely policing issue. We have to work together to address this, and we need to work together to improve confidence, to get people to report crime, to ensure that we can keep people safe. So thank you. I am listening, and we will do I will do everything that I can as the new engagement chief inspector. In regards to cross-border communication, I believe Barbara has answered that. There is organised crime task force in place, and communication continues, and they will identify risk, and they will work together to address the issues and address organised crime. The issue around bed and breakfasts, again, thank you for that question. That has been an issue that has come up recently. We are aware locally that it's an issue. There has been a number of meetings with different councillors in regards to accommodation, particularly around bed and breakfast. What I can tell you is we have tasked an inspector to look at that issue specifically. Again, that is not solely a police issue. We will work with the housing executive, we will work with environmental health, and we will work with the courts and other districts. If people are coming in here on bail, people have rights. If they need bail, get bail, that's up to the court. But what we can do is to ensure that actually if there is risk, then we will manage that collectively. So there is an ongoing piece of work about that issue as we speak. And hopefully in the next few weeks, I will be able to give you a bit of a better update in regards to that. I think that's most of the questions, unless I've missed something, or I'm happy to elaborate a bit more if you need anything else.
I think that's it all. Only there. Okay, I have two more indicated speakers, and I'm going to ask them: is it about the addictions and the police and Justice Department? Okay.
And it's the report.
Okay, Derek, go ahead.
Thank you. But the person, and of course the other end of that is 99. With regard to the 101 service, I mind that is microphone, and I can start off to you that was there. Service totally that I have no.
Derek, I can't hear you at all. You're breaking up. Derek, you're breaking up there.
Okay.
No, Derek, I can't hear you. Listen, I'm gonna let Emma done, and then I'll come back to you. Okay.
Thanks, Chair. I think Derek said he was going to put it in the chat box there, and I was having a bit of difficulty. I think I know what he's going to say though.
Go ahead, Derek.
It's just on the back of, and Chief Inspector, don't think that I'm I'm not here to give you a hard time, but it was on the back of what Councillor Mellon said about the B&Bs. I was one of the councillors that had a meeting with a range of stakeholders about this recently, and I have been in contact with Constable Villa, who was very helpful. What I would say is that in the conversations that I've had with the housing executive, and of course it isn't a policing matter, but because of the vulnerability aspect and the fact that people are being vetted before they come down, actually what the housing executive have been able to say to me is that, look, if there are people coming down the road that have over 100 convictions, like we did have with a gentleman who committed a crime outside Quayside, only the police can stop them from coming down. So I think that's something that really genuinely has to be looked at, because the housing executive have a role and the police have a role, but they're saying to me, if the police don't sign these people off to come down the road, then they won't. And I would welcome word from that inspector that's been tasked on this to keep us abreast of that. Thank you.
Yes, I can. That's a really, really good point. I can answer. It's actually my vulnerability inspector that I've had looking at that. You're entirely right. We can give objections to the court around the suitability of bail addresses, and if it's not suitable for the likes of vulnerability for whatever reason, then we can give them objections. So that's something we will be looking at. It's a really good point, and you have my assurances. That's one of our kind of avenues we're looking at.
Okay, thank you. Well, listen, Derek, I'm going to say your question, but I don't think it's really relevant to this meeting. 101 service.
I don't know if
my neighborhood sergeant.
I don't know if Chair, I don't know if you can hear me.
Yeah, go ahead now. Yeah.
I feel it is relevant because when people wanted to report respect to, for example, or but you can go direct to 999 if there's
no, you're going
to I've tried to.
Derek, I'll ask the question. Derek, I'll ask your question because you're breaking up there again. Well, the questions in the chat box here. The 101 service is not fit for purpose. We're not able to contact my neighbourhood sergeant. So if you want to answer that there.
Yeah, I'll try. Certainly in regards to the 101, that wasn't something we brought in locally. That was brought in service-wide. So I have no control over regards to how it's working and the implementation of it. What I can say is, if there is specific frustrations around 101, I can feed that back and make sure that them frustrations and concerns are directed at the right level. In regards to contact neighbourhood officers, our officers have work mobile numbers. We have increased the neighbourhood teams. If they're on duty, then you should have their work mobiles. We should be as accessible and as visible to our community as possible. So that is something I will take forward with the neighbourhood teams to ensure that actually their contact details are passed not only to everyone within this meeting, but also to the community. So it's a really good point. If you need to get hold of a neighbourhood sergeant or one of the neighbourhood team, that's why we have increased our numbers so that we are visible and we can address local issues. So it's important that they can be reached. So if you leave that with me, I will feed that out to all the neighbourhood teams within Derry City and Strabane.
Okay, thank you, Willie, for that there. Folks, I'm going to wrap it up now. And I'm just going to say, because to be honest, since after the 2 presentations, I haven't heard a lot of questions or anything like that, because the connection's been really poor today for me. But look, thanks to Liam Dunn, Denise, Desi, Nuala, and Liam Stewart, and thanks to Barbara and Wooly for all their very informative presentations. It's good to hear all the great work being done to tackle addiction, both by statutory and voluntary agencies. And I thank you all for coming here today. It's been a very worthwhile process. Thank you.